Good morning, everybody. So welcome to our session this morning on new approach methodologies, moving away from animal testing. The first thing I'd like to do is actually congratulate you on finding this room. My children brought me to an escape room in Milan last month, and I think it was easier to navigate that than it was to find here, so maybe it's just me. My name is Maurice Whelan. I'm head of the Chemical Safety and Alternative Methods Unit at the European Commission's Joint Research Centre, and I'm also head of the EU Reference Laboratory for Alternatives to Animal Testing, better known as ECHA, which is an integral part of the JRC. And it really is my great pleasure to be here with you during this journey this morning to chair and facilitate. I'll do my best. And thank you to the organisers for having faith in me to do that. Maybe they'll change their minds after, but we'll see. Look, before I start, I wanted to first thank some people, particularly the people behind the scenes. If you look in your programme, you'll see the colleagues from EFSA, from ECHA, from the Medicines Agency, from the JRC, who worked really tirelessly and in a real collaborative effort to put this session together over well over a year. So I really thank those colleagues for all the hard work done to get us here today. I also wanted to thank our rapporteurs, our panel here, who busy beavering away there will be taking notes and reporting back and capturing the outcome of this session for a conference report. And also just quick thanks to George for keeping us all on track over the recent months. Some housekeeping. Phones on silence, please. I'm a terrible man for that, but I've just checked mine, so please do. Remember the app. If you want to post questions or comments to the two panel sessions, then you must be logged on to the app and post there. So you can't pitch your questions from the floor here. Everything goes through the app. So please encourage you all. Don't be shy. We'd love to hear what you have to say. I know there are plenty of experts in the room too, so yes, we'd love to hear from you. So, NAMs in toxicology and risk assessment. Look, we all know that we've been working as a community on alternative methods for many, many decades, particularly on in vitro methods. ECFAM, in fact, at the JRC has been operating for a little more than 30 years now. And, we've had a lot of breakthroughs in the early days, particularly, in relation to, topical toxicity, skin sensitization, eye irritation, skin irritation, and so on. Really breakthroughs through the 2000s in terms of the regulatory acceptance of those. But I think many of us in the room who've been in this game a while will remember a real pivotal milestone in 2007 with the publication of the National Academy of Sciences in the US report, Toxicity Testing in the 21st Century. It was sponsored by the EPA. And why was that? Well, for me personally, why I thought was a key moment was it generally was a vision and strategy. Holistic, revolutionary, you could say, and really tackling big issues. It brought, the whole concept of pathways into play, to really reinforce a mechanistic thinking to these new approaches. It introduced the idea of predicting safety rather than adversity per se, which again, it is a pivotal concept. The idea of a big toolbox of in vitro and silico mechanistic methods that need to be assembled in a fit-for-purpose way. And also an emphasis on technology, high-throughput screening. That's really where we weren't using the word big data, but we got to this idea that we actually could generate big toxicological data. Not only to help with the science, but it also introduced the concept that we could actually maybe generate the data that we need on all the chemicals in commerce, rather than just some. So, 15 years has passed since that time. A lot has happened since. Just to mention a few things, we had the establishment of the ToxCast program in the US that's contributed so much to this endeavor. In 2012, we had the establishment of the Adverse Outcome Pathways program at the OECD that's running under the Extended Advisory Group on Molecular Screening and Toxicogenomics, which I've had the pleasure to co-chair with Rusty Tomasz from the US. But again, reflecting the importance of pathway thinking. We had, in 2013, a very important event in Europe where the cosmetics products regulation was brought in that basically banned the marketing of any cosmetic ingredient or ingredient specific for cosmetics that have been tested on animals since 2013. We had the enforcement of our directive on the protection of animals used for scientific purposes. Very importantly there was legal mandate, a legal requirement that if alternative approaches were available for any scientific procedure where an animal is used, they must be used. More recently, in 2020, we had the EPA's work plan on NAMs and bringing that into chemical risk assessment. And just very recently, we had the report from FPA, the European Federation on Pharmaceutical Industry and Associations, talking about phasing in NAMs, an interesting phrasing, but the phasing in NAMs into the pharmaceutical domains. And finally, of course, we have the EFSA roadmap, which is being worked on now. And in fact, we're going to hear about this later today. And in fact, this session will be feeding into finalizing that roadmap. So we've invested a lot in research too. With my colleagues from DG Research, we were kind of doing back of an envelope calculations. And I would say to you, I think we've spent in Europe over €1 billion in the last 20 years directly on funding development of non-animal methods. Vast majority of that has come from EU framework programs, but a lot of that has come from industry too. €1 billion, that's not insignificant. And we have, of course, several flagships now running, and we're going to hear about that later. ASPIS, the Park, that's 400 million in its own right. So this session, we'll be asking ourselves, where are we now? Where are we making progress? And where are we getting stuck? And what does the road ahead look like for bringing NAMs, mainstreaming NAMs in chemical risk assessment? So let's move on to our speakers. They're great speakers, coming from different perspectives, regulatory perspective, policy making, risk management perspectives, academic, and international organizations too. And I know they're great speakers because I happen to have the pleasure of knowing them all very well. So let's move on. I remind you again, finally, please, if you have any questions or comments, to pitch to the speakers. It'll be done during the little panel discussion we have after the talks. Talks are 10 minutes, and hopefully we'll get through and leave enough time for the discussion. So first up, I'm great pleasure to introduce my commission colleague, Katrin Schutte. Katrin is a policy officer in DG Environment, and Katrin is very much involved in REACH and also the Directive 2010-63 on protection of animals used for scientific purposes. And I know you do a whole lot more, but we better move on. Katrin, the stage is yours.
Good morning, all. And first, I would very much like to thank for the opportunity to be with you here this morning, and I'm looking forward to the discussion after our talks. So I was asked to start off the morning by explaining how we are using NAMs in risk assessment under REACH. So let's start with that. A little bit of background. We do have NAMs in REACH already. We're using them for as standard requirements already for the topical endpoints that Maurice just referred to. So that is a good thing and that is a success, but surely we want to go further. We also can accept NAM-based adaptations today in principle for systemic toxicity and more complex endpoints, but at the moment, as most of you will know, they are rarely accepted at the moment because the mechanistic understanding, unfortunately, is still incomplete, and the NAM methods we have today, at least, cannot predict adversity yet, and that is asked by our current system. So this really is the issue that we are working on right now and that we want to advance in. As you're probably also all here in the room well aware of, is the fact that in the end of 2020, the Commission published the EU Chemical Strategy for Sustainability. And it is an ambitious strategy that aims to do all the things that you see depicted here on the screen. Today, I would like to focus just on two: the area of improving knowledge on chemical properties and uses, and the fact that we pledged in the strategy that we want to promote innovative assessment methods and their regulatory updates. So this action or goal means to do this internationally, but of course we should also aim to do so in-house. So more concretely in the strategy, we are announcing that we want to amend REACH to enable effective identification of substances with critical hazard properties, because especially for substances in the lower tonnage range, we're convinced that there is not enough information on those substances' properties yet. We would also like to identify all carcinogenic substances in good coherence with the other Commission activities against cancer. And as I mentioned, we are pledging to promote innovative risk assessment tools with the ultimate goal to move further away from animal testing. So in order to achieve that, we have embarked on a CSS action to amend the REACH information requirements, which was kindly led by a group of experts at the JRC with the support of a steering group with members from ECHA and Commission services. And the task for this action was to ensure that low tonnage data have enough information to enable a chemical safety assessment. So that requires currently the 28-day study. To address all the critical hazards that you see depicted here on the slide, and to also generate information on toxicokinetic properties that could then later on support grouping, read-across, and in vitro in vivo extrapolation. In order to make a proposal, our JRC colleagues have launched a stakeholder consultation and have asked everybody who wanted to input what NAM-based strategies people are using these days to derive a DNL or a PNEC that could be used for classification and labeling, for PBT, VPB assessment, or for assessment of any of the other critical hazards that were mentioned. And we got quite some detailed and good responses. You see here a summary of methods that were suggested to us. There were more methods reported for the more topical endpoints that we already know, but also for some STOT endpoints and for developmental and reprotox, which is good. But there were rather few methods for the endpoints that are more complex and the more systemic endpoints that you see listed at the bottom of the slide. And when we discussed within the steering group and also with some member state experts in Caracal whether we could introduce the methods, some of the methods that were proposed, then a lot of questions or reservations were raised, whether they are standardized enough, validated enough, whether they can one-on-one replace a animal method for systemic toxicity. Also a big question, how should we use the results of a NAM method that is not yet OECD validated? Can it be used to make a final decision, or should it be used to trigger further testing? There was also the issue mentioned that the results probably are very useful in a weight of evidence evaluation, but a weight of evidence without a clear structure how to do it is a tough cookie to evaluate for regulators. We have to find a solution to that as well. And finally, for the areas where we don't have methods yet, we had discussions how one could develop incentives to obtain more of these methods. So I don't want to go into all of these problems, but I advise you to have a look at this report from the JRC that goes more into detail and also offers some solutions to them already. So we looked with the team of the CSS action on information requirements, what could we do of the aims that we have if we were only using the NAMs that we have available today? Well, unfortunately, for all the endpoints that I crossed out here with a cross, we had to conclude that today we cannot yet address these endpoints. So what would we need in the future is therefore the question that we asked ourselves. Definitely we would want to be able to waive information requirements with the use of NAM-based methods rather than triggering further animal testing with NAMs. But how to do that really is a balancing act, because we would want the flexibility to accept as many validations as possible, while at the same time we need to be able to do so with a reasonable amount of resources put against them in a very generic system like REACH, which is a unique animal as compared to the agrochemicals or pesticides legislation, where you have approval substance by substance. So really what I would like to, or hope we can discuss later, is how we can rethink standardization, validation of NAM methods, how we can address, or how we need to address adversity, uncertainty, and classification criteria. So that in the end, we would hope that a long-term objective for REACH information requirements could be achieved that aims at higher safety on the basis of basic knowledge about higher number of substances, while we would perhaps require less information on each individual substance. And that should lead us to minimize animal testing with the aim of complete replacement at a certain point in time. And I would like to thank you very much.
Thank you so much, Katrin. Excellent, great start. Reminding you, please, if you have any comments or questions for Katrin, put them on the app. So our next speaker is Tomasz Sobanski. He's from the European Chemicals Agency. Tomasz is a team leader up there, and dare I say, a real champion of NAMs within the agency. So over to you, Tomasz.
Thank you very much, Maurice, for such a kind introduction, and thank you, organizers, for having me here, and good morning. Yeah, I have a challenge, double challenge. First of all, because I was asked to present you what ECHA is doing towards, trying to think how we could use NAMs and alternatives methods in the wider perspective, but it won't be possible in 10 minutes. So I will just try to focus on few key aspects there. But the second challenge is that majority of my points was already covered by Katrin, so I'm really sorry. You might be bored, I may disappoint you, but I will try to extend a bit some of those points from more practical experience, from the regulatory experience and operational experience. So first of all, at ECHA, our approach towards 3 Rs are based on 3 pillars. First is effective implementation of our integrated regulatory strategy. Probably you've heard about it, that now we don't look at the different processes like, registration, compliance checks, substance evaluation, identification of substance of concern, but all those things are connected, joined together to bring us to identify the substances faster for additional risk management measures and regulatory actions. And then within this strategy, we have as well developed our internal way how we could incorporate NAMs into our internal system. So we are using NAMs already to support grouping, prioritization, to pick up the substances which we believe they required more regulatory attention. And we are doing it internally already. And the second pillar is basically investment in international activities that promote alternatives. So we are actively participating in many initiatives and many projects. And I think for me personally, there are 2 which I think they are very special in this context. Is Accelerating Pace of Chemical Risk Assessment APCRA Consortium, which basically groups regulators across the globe to discuss how we could do better, how we could use more efficiently NAMs. And we are doing it via different case studies. And the second is ASPIS Consortium, which is trying to group and combine all those Horizon 2020 new research projects and try to see as well jointly how we could use the synergies, but as well differences between those projects in the most efficient manner. And then the third pillar of our strategy is making data available. mainly classical data which have been submitted via our registration dossiers, but those data are, we believe, are of key importance, and we are doing it in 3 ways. First, you have a ECHA dissemination website when you can check basically whatever we know about toxicological properties of the substances there. Second way is through the QSAR toolbox. We release the ECHA data set within the QSAR toolbox, and by the way, we are as well strong supporters, and we are financing as well the development of the QSAR toolbox. And the third is via so-called Euclid downloadable data sets. So you can as well just download the whole toxicological data set per endpoint and use it within your local Euclid instance. So they are the ways how we are trying to do it. Now, once it comes to the challenges regarding the NAMs, as Katrin already mentioned, is really keeping the balance between expectations and needs. And we have to keep in mind that in the REACH is slightly different than sectoral legislation because of this horizontal nature. It needs to fit many other pieces of legislation and needs to be relatively robust and fast and easy. So we cannot have too many open ends because it does not give the certainty for the registrants. They don't know what to expect if they have to do the weight of evidence, and as well it is for us very challenging to keep the consistency in our decisions if we have too many open ends. So we need to take it into account when we are discussing as well what it may mean for NAMs. And then we have to as well be realistic how much time it takes to develop NAMs, then to convince people to use them and so on. And you've heard already, I think, and you've seen it, Katrin, slides. Many people are pointing this, but that probably NAMs uncertainty is higher. I wouldn't say it's higher. The problem is different, and we don't know how to compare those different types of uncertainties comparing to the classical toxicology. And this is the challenge, because if we don't know how to compare them, then we are trying to be precautious. If we are trying to be precautious, then we are trying to be conservative. And this is how we may end up with slightly higher conservatism level when we are using NAMs. And this is something which we need to reflect, how to balance between usability of the system and robustness. And of course, we need to keep in mind that whatever NAMs we will have in the system, we should have them as internationally recognized standards, because we would like to, we have the system when you are doing you are covering your information requirements in US or in Canada or in Europe, you can use the same data in other legislation. So you shouldn't be forced to regenerate or generate more data or different data. So this part, I think, is quite important, especially for industry. We need to think about the NAMs which will be widely accepted. And success stories, I think Karin already covered. I'm not going to repeat. For the one-to-one replacement on higher systemic tier, Karin mentioned already that we probably is not possible. I wanted to be just more explicit why it is not possible, especially for each. So the expectations that you will, for example, regulatory endpoints are based on built around very concrete hazards like toxicity to reproduction, cancerogenicity. And then in the information requirements, you have specific tests listed what have to be done in order to cover this endpoint. In order to cover this endpoint, you need to do this test and this test. And then we have Annex 11, which is saying, okay, you can deviate from the standard information requirements, but you need to provide the same level of information. And this is the biggest challenge, because how to provide you with NAMs the same level of information as classical toxicological study with hundreds of different endpoints, observation, histopath investigations, and so on, or behavioral even observations. In vitro culture will not behave. We cannot do it. So this is something which we need to think as well, how to switch the system and why it is so challenging at the moment. And here, basically, we list five things which we believe are important for the regulatory acceptance. Normally, if I would have more time, I will go through all of them and I will tell you what we are trying to do at ECHA to cover all those, but at the moment I will just leave them. Maybe we can discuss those elements later. And then talking about brighter future and opportunities. So, of course, we have to use opportunities which we already have, and then we need to think about the future, what we could do better. But first, we have to do better integrate new approach methods in the current regulatory system. We are doing it already internally, but hopefully with the REACH revision, we could be able to do it as well a bit more with as well registration data. Better use of data. We still can develop much more in terms of models, in terms of reusing the data, in terms of grouping. We just need to think how to streamline this part. And then we need to increase in collaboration between regulators, researchers, and industry. This is the mind-shifting process, which really requires a lot of dialogue, a lot of discussions, and a lot of building the mutual trust between the key stakeholders. And I think we all need to be engaged in this. And if we are talking about the ultimate goal, full replace of on animal testing, we need to consider several things like how we can assure the same or better level of protection, how we can redefine main elements in the current system that will be better fitted or more compatible with NAM type of evidence. Then we need to think about all possible challenges in regulatory framework, especially for us regarding the connection between REACH and GHS system. And finally, we need to have a buy-in in all stakeholders. It's not only one part exercise. We need to be all committed, and we need to all try to get there together. And we need to be realistic in terms of timelines. So with that, I think I will thank you, and hopefully we'll have more time later on to discuss. Thank you very much.
Thank you, Tomasz. Great. Please, reminder, comments and questions to Tomasz on the app, also particularly our online community. It's a way to connect with you. So our next speaker is Rusty Tomasz. Rusty is director of the Center for Computational Toxicology and Exposure at the Office of Research and Development at the US Environmental Protection Agency. Rusty.
Good morning. I want to get something out of the way right away. So thank you for the introduction and invitation. But my black eye, right? I've been through a lot of travels for the past week, and I've met typically two types of people. Some of those are really very polite, and they don't say anything, but they keep looking at it going, what happened to that guy, right? And then I have another type of people that come up to me and say, you know, what happened? Or I hope the other guy looks a lot worse, or something like that. But I can rest assured, I did not get this fighting with my regulatory or risk assessment colleagues, fighting over the use of NAMs. I got it when I was coaching my son's Little League baseball team and throwing batting practice when I was pitching to him. So I got hit by a line drive. So that's the story. It's not as good as probably fighting with my regulatory colleagues, but that's the truth. All right, so now that we got that out of the way, all right, I'm going to try giving you three numbers to set the stage of why I believe, at least, there's probably more, but three numbers of why I believe that NAMs are probably a critical component of where we need to go, at least in the States, for risk assessment and toxicity testing, right? The first number is 75%, right? That is a number of chemicals, that percentage of chemicals in the U.S. economy that lack repeat dose toxicity testing. Right? And you consider everything that's non-confidential on the U.S. Inventory, that's the number of chemicals that lack repeat dose toxicity testing. Think about that. After decades of our traditional toxicity testing, that's still the number of chemicals that we still lack testing using those traditional approaches. Right? That's a big number, right, when you consider the number of chemicals in our economy. Right? The second number, 6 to 20 years. Right? That's the number of years it takes to go from point A to point B in both testing a chemical using traditional methods as well as performing a risk assessment, right? And you think about that for a minute, right? If you identify a chemical as a priority, right, that could be a problem, right? It's going to take you nearly half a generation to generate the toxicity testing information as well as perform a risk assessment and get it through to where you can set a reference value for a safe exposure, right? That's a long time, right? We can do better. Right? And the last number, 43%, is another number, and it represents some data coming out of the pharmaceutical industry where they were looking at the positive concordance between the toxicological responses in their rodent-based preclinical toxicity tests and the adverse responses in their clinical trials in humans, right? So essentially what that says is that about 43% of the toxicological responses that they see in their rodent-based toxicity tests are observed in humans when you do the clinical trials. So essentially, if you walk back a little bit, right, the majority of those endpoints that we are setting our current reference values on in the 10 years that it takes to do a risk assessment aren't generally observed in humans, aren't the same as what you would see in humans, likely, right? So that kind of sets the stage, and that was why I think it's going to be important as to integrate NAMs in our chemical risk assessment. So 3 considerations of how we can change those numbers, right? And I think part of this was alluded to by Morris in a 2007 report. Part of this was also alluded by Tomasz in, at least Reach and ECHA are thinking about new approach methods, right? And that's really making sure that we can distinguish between prediction and protection, right? In that same set of studies that were evaluating the concordance between the preclinical studies and the human clinical studies, right? It turns out that those preclinical rodent models, right? Even though you didn't have you had 43% positive concordance, those rodent models were able to correctly identify and predict the absence of response in humans, meaning that those rodent models were really good at protecting, in many cases, from adverse effects in humans, right? So if you think about that, right, in our current risk assessment processes, right, we're setting our standards based on a no observable adverse effect level, right, and layering on certain assessment factors. And in many cases, we've been using our in vivo models to set protective goals, not necessarily predictive goals, right? And I think that's very important and has big implications for how we are going to evaluate our new approach methods, right? And how we can use them in our toxicological testing and risk assessment paradigm, right? The other consideration is that we need to at least begin to take off our rose-colored glasses in setting our expectations for our new approach methods, right? And setting our expectations for that validation process, right? Are we going to continue to do multi-year ring trials on every NAM or every combination of NAMs, right? And still try to address that 75% of those chemicals in the U.S. economy and the 6 to 20 years, right? It's just not feasible, right? We need to begin to move towards some performance-based standards in how we're going to accept the NAMs for regulatory application. So let's set our performance standards. Let's set our standards for reproducibility and for what the biology that they represent, and begin to move towards that as our standard for validating new approach methods, and not necessarily spending that multiple years in trying to validate each and every NAM, right? Also, we need to take off our rose-colored glasses in terms of setting those expectations for those new approach methods. If we are going to benchmark them against our traditional models, if we do feel our traditional models have been providing good protection standards, or even in certain cases predicting our toxicity, right, we need to really think twice and characterize the variability and uncertainty in our in vivo models, which hasn't been up till now fully appreciated and fully done, right? We need to characterize those and set realistic benchmarks that we can evaluate our new approach methods against, right? And this is also going to be important for setting those appropriate expectations and moving towards addressing those 3 challenges. My last consideration is represented by the number 0.043 megahertz. Does anybody know what that represents? See some smiles maybe in that. Well, in case that you don't know, that's the computing power of the Apollo 11 computer, of the computer capsule that landed on the moon, right? Think about that, right? Your current iPhone in your pocket has 60,000 times the processing power of that Apollo 11 computer. That still achieved what we thought was an impossible goal, which was landing on the moon at the time, right? Think about that, right? Are NAMs perfect? Right? Of course not, right? We still have plenty of room to innovate and improve our NAMs. We have a lot of biology that we need to cover. We need to address many of the technical imperfections that we currently have in our new approach methods, right? Are we making progress? Of course we are, right? We're starting to layer in ways to retrofit all our in vitro assays for metabolic competence and incorporate one of the biggest challenges that's always been leveled at me. Your new approach methods don't incorporate relevant xenobiotic metabolism. We're doing that, right? We're enabling retrofitting many in vitro assays for metabolic competence and incorporating bioprinting approaches into addressing and putting in metabolic competence in ways that we can more relevantly incorporate that into our systems, right? We're developing more and better organotypic and and physiological systems, microphysiological systems for better addressing tissue and organ level responses, right? And we're also incorporating omic type technologies and high content imaging technologies to more broadly cover biological space, important biological space that we felt maybe may be missing with our new approach methods, right? So we're capturing many of those things. But I would argue that even despite those challenges, right, our processing power of our NAMs is still better than 0.043 megahertz, right? Are they perfect? No, but they may be good enough to get us through our goal, particularly considering if we appropriately set our prediction and protection goals, right, as well as characterize the uncertainty, take off our rose-colored glasses and characterize the uncertainties in our current in vivo models, as well as set appropriate validation approaches and base them on performance. Right? If we can do that, I think we're going to get to where we need to go. And I'm done. Thank you.
Terrific, Rusty. You used your time on the plane over very well, obviously. Rose-coloured glasses. Did our rapporteurs catch that? That's going to be the quote of the session, I'd say. Okay, let's move on. Next is Bob van der Water. He's head of the Division of Drug Discovery and Safety at the University of Leiden. And many of you might know Bob too as being coordinator of previous big EU flagship project, EU Tox Risk, and now glutton for punishment. He's coordinator of a follow-on ASPIS project, but I'll let him tell you about that. Bob.
Yeah, thanks, Maurice, and also the organizers to give the opportunity here to say something about the academic vision, basically. And often that's really collaboration in the European project. So I really want to focus on our learnings in our past project that Maurice already mentioned, the EU Tox Risk, but also allude a little bit on the follow-up project and describe a bit what we're aiming there based on our learnings as well, of course. And it relates also what Rusty talked about, really that we have the animals. I mean, in the farm industry, it's more than only rodents. If you take all the animals, then it's about 70% prediction. But of course, they do not cover the entire population as well, elderly, kids, etc. So we really need to move away from these in vivo models to more NAM approaches, be it in silico or be it actually in vitro technologies. Now, if you look what is available, of course, there's a lot available, but has it been used in such a way that you get learning from it? So that's what we did in the EU Tox Risk, basically gather the relevant tools, the 2D models, more advanced models in different test systems, and really get understanding how you can use them in particular case studies, and I'll come back to that later. But it's not only about tools that are there. Of course, in academia, you get continuous development. So whatever we have now in 5 years' time, we have new development. So you cannot really pinpoint that toolbox and maintain it for eternity, because in 10 years' time, the technologies will do much better. So that's something you keep in mind as well. But also keep all those people in line, of course, that develop these tools and what their requirement in the end will be. So in our project, we worked on IPS technology, genome engineering them for reporters, IPS multicellular liver systems, diseased liver microtissues, 4 organ on chips, so really advanced technologies that had never applied basically in our application of NAMs in safety testing. But it's also about technologies that are more in silico approaches, be it structure modeling, really take advantage of structures that we have and see if we can really use that in structure modeling approaches to define these ligand chemical receptor interactions at the molecular level. Or predict what is happening actually in your in vitro system with respect to exposures in your cells really, or move it all the way from all the data that you have to quantitative AOPs and get understanding what data you really need to get a quantitative assessment what the endpoint could be. Now, Rusty mentioned the high throughput technologies, and really in our projects we have picked up on what's going on in the US and we collaborate on that. Now, can we apply these high throughput technologies in particular cases? And in this case, we did it, for example, in the context of read-across case studies to really look, is there particular gene signatures that are similar, almost exactly the same, if you look in a read-across setting? And actually we could demonstrate that using particular case studies. So certainly these omics approaches will be really valid as a NAM for application in safety testing. In particular because we would cover all the mechanisms as well. The understanding that we need, of course, when do we cover sufficiently the human biology in the various test systems that we may need to use them. Secondly, the question is, okay, if we then talk about these different test systems, do they actually have different responses? So if you take the same set of chemicals and you expose them in different test models, what will be picked up by the one model? Does a neuronal test system pick up the neuronal toxicants and only the neuronal test systems, or will just a HepG2 liver cell line will pick up the same responses? And what are the differences then? So that understanding is also very important to really get confidence in the test systems that eventually you would pick. So there's a really academic questions that we address here. Second one, if you follow up on that, you have your test system, but what is it representing? Is it representing me that may be really susceptible for DNA damage responses and have a poor repair? Or is it somebody that basically will get 120 years old and will have very good adaptive response systems? So what are the test systems really representing? So getting the understanding of the inter-individual variability on the toxicodynamics, that understanding is really important to also get a feeling, well, if we use the test systems, do we get sufficient protection as well? Now we have all the test systems, but in the end it's also reporting the test methods. Do we have a particular structure that everybody using the same test method description, have a database so that it's really clear for the regulators what the test was really about and what it can perform and what the variability would be? So can we define that as a community and get all those test methods together in one database so that it's very easy for regulators to really get an understanding what the validation would be and what the evidence is that the test method can do what you promise it to do. And we have reported many test methods basically in this EU Tox project and have a template that we want to expose also to the community to follow up on this. Now, you have the methods. I mentioned case studies. It's all about case studies in the end. I mean, you can have your method, but can you apply it? And that's really key, I guess, to get understanding of the validity of one test method or a combination of test methods, be it combination of in silico and in vitro, be it methods that do toxicokinetics or toxicodynamics analysis. And that's what we really did in this project, I think successfully, although I'm a little bit biased, of course, as you may understand. But it was really the cooperation between various stakeholders, industry, regulators, scientists, that I guess really made that success. And then in collaboration with OECD also report these case studies and get really commenting back from the regulators as well, whether these strategies are actually fit for the purpose, whether you provide sufficient safety in the end. And I guess it's very important for any future project that you really get this interaction with the key stakeholders and not at the end of projects and then start discussing your fantastic and excellent tool that you developed. You need to do it while developing, I think. But not only then keep it to that, but also make sure that they are exposed to the stakeholders that need to use them. Because if it remains an academic exercise and then the test system, you validated the case study, but it's not accessible. Those test methods need to be accessible. So building platforms where we integrate all the test methods so that industry has access to it and then can apply it and provide it to the regulators in the end in real dossiers, that's of course essential as well. Now, we did particular read-across cases, but the difficulty is that, if you start from scratch, you have no clue what your compound may do. You need a different strategy, and that's what we established in our grant proposal, but was successful in the Risk Hunter project that is part from ASPIS. I briefly touch on it later. It's really see how can we now build a framework for safety testing where we would start in different modules. First look at external exposure, then look at internal exposure, what tissues are reached, what metabolites are being exposed to in the different tissues. Look at the hazard of those exposures then at the tissues. And from that hazard assessment, maybe come up with hypotheses on a potential adverse outcome that you can then further refine in testing in advanced test methods. So that's basically the aim in a nutshell of the project. I do not do justice, I guess, on the complexity of all this. But it's really understanding the toolbox components in this entire framework. Are they fit for that purpose? Can they do it? And if so, what is the uncertainty that you would still have in each of those components? And if you take then the entire set of NAMs in such an approach, what is the overall remaining uncertainty? So that's what we try to learn in this project, also in collaboration with other projects. So overall, what are scientific questions that we still need to have? What are the toolbox components eventually, if we talk about in silico and about the in vitro toolbox components? Do they represent the human physiology? I mean, we talked about benchmarking to animals, but we need to benchmark it to human pathophysiology and see if we get the mechanisms detected in our test systems that are human relevant. So that also relates to covering the human biology in general. Do we have all the tissues there that are at risk, basically, if you talk about the safety assessment? But then also, how to integrate all those NAM. I mean, if then a company would need to test them, a panel of them, how to access them, and then integrate all the data as well. That's very important. And do we have sufficient certainty in the end? And ensure in the end the quality of the NAMs, and that there's consistent quality in the data that's being generated, so that the regulators also have a clear understanding that the data and the data analysis provide confidence. Now, our project I highlight some of our learnings basically. That continues, of course, in the context of ASPIS, mentioned by Maurice. It's not only Risk Hunter, it's also OnTox and the Precision Tox project that collaborate and see where can we make together impact. But it also translates our learnings to the PARC projects, which is an even bigger monster that we have to manage. But also see, with even more partners in there, get that learning and see how we can really get all those tools in a similar framework and have impact on safety assessment. It's not only at the European level. I have to hear the example of a Dutch project. Also, of course, national governments invest in this area, and also those need to be connected to all those achievements that we want to have in the future. And that's where I want to stop. So I thank you.
Thanks, Bob. That was great. A lot of content to cover in a short time, isn't it? But did a wonderful job. So our final speaker of the session is Bob Diderich. Bob is head of the Environment, Health and Safety Division at OECD. Bob.
Thank you, Maurice, for the introduction, and thank you to the organizers for inviting me here and allowing me to say a few words about what's going on at the OECD with the development of NAMs what are lessons learned, and where do we want to go in the future. So one of the lessons learned, and it has been said repeatedly, is that we need to continue increasing our mechanistic understanding. This has been the underlying philosophy for developing the test guidelines for identifying endocrine disruptors for certain modes of actions, and we continue to heavily invest into the development of adverse outcome pathways to be able to develop screening methods for identifying endocrine disruptors that act by a novel mode of action, like the thyroid pathway or the retinoid pathway. And you might have seen in the news yesterday that EFSA is just issuing a call for tender for the development of adverse outcome pathway for just those projects. We also need to continuously evolve our test guidelines program. While we have been able in the past to develop standalone test guidelines to replace animal tests for irritation and corrosion, for skin sensitization, we had to invent new tools. We had to invent what we call a defined approach, which combines a number of results from different test methods, including from computer-generated results into an overall result through a fixed data interpretation procedure. So that's a new tool we had to invent to be able to fully replace an animal study with non-animal results. And that such new considerations, such new tools will allow us also to move towards more complex endpoints, like the work that is currently ongoing under the leadership of EFSA, the European Commission, Denmark, and the US, on developmental neurotox, where we're developing a guidance on the use of a battery of in vivo assays in order to assess developmental neurotoxicity. Bob van der Water already mentioned this. I mean, exchanging experience with the regulatory use of NAMs is really crucial. Getting regulators around the table and having them explicitly say how they would be able to use a NAM, how they would not be able to use a NAM, and why, and what would it take to be able to do so, is really pushing the envelope. And so Bob van der Water already mentioned the OECD IATA case study program, where we're trying to do exactly that, and trying to distill the lessons learned that allow us to further develop guidance that are missing in the application of new approach methods. And I'll specifically highlight here one of the gaps that was identified, and it was filled by guidance for the characterization, evaluation, and documentation of physiologically based kinetic models. This was published last year and responds to one of the needs for the application of new approach methods. In parallel, we need to continue developing our quality assurance standards and make sure that they apply to new approach methods. We know how to apply good laboratory practice to in vivo studies. We know how to apply them to in vitro studies. But what about computer generated data? What about QSARs? And we find that GLP inspectors are very responsive to these new challenges and are very eager to find ways to apply the principles of good laboratory practice to those new emerging types of results that we need for assessment, and that we need to comply with mutual acceptance of data, so that data can be exchanged between countries. Bob van der Water also mentioned that it's important to have common reporting standards for new approach methods. Indeed, it's about getting regulators to say, what is it that I need to see in terms of data, in terms of results, in terms of metadata, so that I can decide whether or not a result from a new approach method can actually be used in my regulatory setting. And over the years, we have developed quite a number of those standardized reporting methods to, again, push the envelope towards regulatory use of NAMs. And I'll just highlight the one on omics on the right. We are close to publishing, I think this year or next year, reporting frameworks for transcriptomics and metabolomics. So what does the next 10 years going to bring us? I think you've heard this through what Rusty already said. We're going to go through a mix of developments. We will continue to develop NAMs that are pathway defined based on adverse outcome pathways. But we also will need to develop NAMs that are pathway independent, because we need to address systemic toxicity, and developing individual NAMs for all of the hundreds of endpoints that are measured in a 28-day study is probably illusory. So we will need to look for pathway independent NAMs. And we will need to develop the models that link the NAMs to in vivo responses. And of course, we will need to look for more human relevant models. And we will need to do all of that in parallel over the next 10 years if we want to make progress. And that's it from me. Less than 10 minutes.
That's I was telling before, saying there's only one key performance indicator for chairs of sessions on time. But thanks to our speakers, we're very much on time. So can I invite you all now to take a seat? Okay. So for the time we've left, we're going to take some questions from online, and we can, don't know if you can read them here. Can we go back to the first one, please? Oh, no, here it is, yeah. So, Rusty, great talk. That's a good start anyway. It doesn't move right along. Simple question. Well, if we work on the protection goal instead of the predictive goal, how do we tackle a very common question, which is, please ensure that NAMs are able to predict the bad guys for critical hazard, so cover everything. Is this an apparent conundrum? From Marco Cavora.
I think it's a challenge, but it's not a conundrum per se, right? I think, to be truly predictive, you do as some of the other speakers implied, which you really need to get down to mechanism. There are chemicals that really act by a predominant net mechanism, and NAMs are certainly tailored to identify those mechanistic targets and pathways that are perturbed by chemicals, right? And that's the path to true prediction, and whether those mechanisms are relevant to humans. Right? Protection from most of those chemicals that are really promiscuous and dirty, right? Protection is really provided by making sure that you are identifying the dose at which no biological pathways or important biological pathways or targets are perturbed, right? And in that way, you're assuring that you have a protective dose at which you're identifying. So in that way, I think you're getting at the ability to protect against the majority of chemicals while still being able to predict those critical endpoints. And those critical endpoints reproductive, developmental tox, and all those that we're really worried about from a severity standpoint are really the combination of those mechanisms that lead to those responses, right? So I think you can achieve both, right? It's just by integrating the NAMs in the correct way to provide both a protective context as well as a predictive context. And just realizing also, I think in our current in vivo approaches, we are really, for the majority of those chemicals, we really aren't identifying a mechanism. We're really protecting against the most sensitive adverse response and using them in that protective context.
Yeah, good. I mean, maybe I go to Tomasz first, though, because it kind of came up in your talk a little bit about this perception that, you know, the current animal tests are, you know, catch-all, that they cover all the bad guys, as Marco mentioned. And somehow NAMs have got lots of gaps and will miss things. How does that play out in your discussions with your colleagues?
Okay. Yeah. And when I was thinking, what are the most important things to be addressed for moving further with regulatory applications of NAM, the demonstration that you can really, you know, filter out. Basically, you can as well confirm safety, not only fish out the bad guys, but as well conclude that actually chemical is not hazardous, is one almost on the top of my priority list. Next after IVIV. So, and you know, I don't know the answer how to do it, but I'm pretty sure that to some extent we have already solutions on the table. It's just a matter of demonstrating that they are really working. And in order to demonstrate that they are really working, we need to test a bit of those non-hazardous chemicals, which we are never using to characterize our assays, which we are never using because they are not, you know, from the research perspective, from the risk perspective, they are not super interesting, but we have to do it. We need to take relatively safe chemical and demonstrate that they are really predicted to be safe as well during using NAMs. If we will have this, combining with that we know already that we could predict many hazards using NAMs, this will probably maybe the first step towards the really thinking about tiered application system incorporating NAMs.
So problem formulation is essential here, isn't it? Bob, you wanted to add something?
Yeah.
Not
no,
Bob Diderich, Bob D. Sorry.
Too many Bobs.
You can never have enough too many Bobs. Yeah.
The conundrum comes really from the fact that we want to move away from animal models, and we have no human reference data. So we have nothing to establish protection. So we need to move away, we have nothing to establish predictivity. So we need to move away from trying to be predictive and trying to be protective. But that does mean, as Katrin pointed out in her talk, that we maybe need to redefine from a regulatory point of view, what does adversity mean? I think that's really where the conundrum lies.
Yeah. I mean, Katrin, would you like to come in on that? That you mentioned a lot the regulatory endpoints, and you had quite striking crosses through them, and we were all kind of getting a bit depressed. And you were saying, but I mean, is that maybe part of the problem, or you know, the traditional endpoints and the comparing the?
It certainly is part of the problem, no doubt. And I was just thinking while Bob was speaking that the key to the success we've had with the skin sensitization endpoint, where the defined approaches are very successfully used for really characterization of the large majority of chemicals today. The benefit we had for this endpoint was that the human reference data was available, at least to a certain extent, and that helped a lot. So for the other endpoints, indeed, I think we have to become creative and open-minded to see how we could recalibrate our expectations of what we can do.
We'll come back to that in a moment. Bob van der Water, would you like to add something? Or did you
I mean, it's not so black and white. It's either protection or prediction. You know, we have sufficient information about mechanisms for some of the endpoints in repeated dose toxicity. But for liver tox, the most important target organ, you could easily say, well, no, for liver tox, you could also have prediction, right? So in your data that you would gather, there could be a mixture of protection, of course, and that may be in some instances only possible, but in other instances you could also say, well, we have protection for the liver and for the kidney, so for particular organs where we have much more information, know what particular pathways are active. So it's not black and white. Yeah.
We'll go to the next question from Julia Filippowska, who's touching on, you know, the validation benchmark, and go back to what Katrin just mentioned. You know, again, it's this, you know, more conventional approach of benchmark against animal models, and is that really where we want to go, and what are these creative, maybe I shouldn't ask you, but you're a customer of the creative approaches. Yeah, but what are the more creative science-based approaches? I mean, maybe start with you, Rusty. I mean, you're always been asked this, you know, and you mentioned it in your talk. How do we demonstrate the scientific credibility without falling into the trap of the one-to-one comparisons, particularly if it's not even possible sometimes?
Yeah. Hello? Yep. I do think that it's a combination of approaches, right? I do think that there's performance in terms of the repeatability, reproducibility, right? Those are really the fundamental parts of the validation that of why we have the paradigm that we do have, right? So that part, I think, is a performance-based approach to demonstrating that, right? The other thing that, in terms of prediction, right, setting up and evaluating our models for the biology they represent, right? Do they represent with sufficient breadth as well as fidelity those biological pathways that we believe are important in terms of the toxicological responses? And Bob alluded to that. So that's a combination, and particularly with what the second Bob was talking about in terms of in the situation where we don't have the types of human data that we need to really compare our models to, right? And so I think that needs to be folded into a more performance-based, fit-for-purpose validation framework to be able to move forward with demonstrating the performance of our NAMs and building confidence in them in a different way than we have in the past.
Yeah, I mean, does anybody want to comment on, you know, if you know, comparison and benchmarking is always part of scientific development. But somebody mentioned in their talk about talking more about comparing things or benchmarking things in levels of protection that one achieves. Somebody talked about protection goals, we need to be clear about protection goals. I mean, does somebody want to speak to that about, you know, moving this question away from strictly a toxicological predictive tox problem, which scientists love, of course, to a broader question about levels of protection achieved? And I'll come back to your numbers again, Rusty. I mean, if we take a bigger picture about how many chemicals aren't being assessed, so I guess we're not protected from chemicals that have never been assessed. We don't know, you know. So does anybody want to speak to that about what does protection mean? Levels of protection, can we achieve equivalent or better levels of protection, Tomasz?
Yeah, and that was, we had quite many discussions on that already, but I think yesterday during the mixture session, our colleagues from the Commission said actually protection level is set up by the combination of data and regulatory piece of legislation which enforce to generate this data. So whether we like it or not, our current protection standards are set based on specific outcomes from specific test, in vivo test guidelines, mainly in vivo, with some exceptions. So this is probably our benchmark, whether we like it or not. However, we have to take into account when we are comparing or when we are doing the benchmarking against those in vivo standards, the level of uncertainty which are associated with that. We have to have a good understanding on what are those uncertainty and trying to compare the uncertainties which are coming from NAMs, and maybe the outcome will be that they are very comparable, and maybe we are not so far. So, but we have to probably start from somewhere, and I believe that the animal test is the starting point.
Yeah. Katrin, I'll come to you with a fair question. Looking at the chemical strategy for sustainability, it's from Andrew Turley. And he's simply asking, should we expect an increase in animal testing as a result of the chemical strategy for sustainability and its objectives, and particularly things like information requirements for EDs and so on? Is that the prospect that we're looking at?
I think there's only one answer possible, and that is an honest answer from my side. Otherwise, I think I wouldn't do any expectations justice. And with the big ambitions we have in the strategy to characterize chemicals better than we know about them today, and given the current status of NAMs that we're discussing today, I think it will be unavoidable that the implementation of the strategy will lead to an increase in animal testing. To use the example of the endocrine disruptors for a moment, obviously we are planning to put the battery of NAM methodologies for the different receptors into the requirements. But those more closely involved among you also know that the NAM methods today are not able to demonstrate adversity. So as long as we are operating in the system as we have it today, we have to follow up with in vivo testing to fully identify them. And for the other endpoints that you noticed the crosses on in my presentation, it is a similar situation that we will hope to modify the information requirements such that we use more NAMs wherever that is possible, but they are not yet able to go the full 9 yards to characterizing those endpoints.
Okay. I mean, we're still in the process in the Commission of, conducting the impact assessment and looking at different options, so this isn't a done deal yet. I mean, it'll be more in the autumn when we see what proposals might emerge. But, thanks for your frankness. Jose Tarazona, a real champion of NAMs at EFSA, is asking, fair enough, Katrin, but I suppose it goes to everybody. There aren't sort of off-the-shelf solutions for the systemic endpoints you mentioned, but they're exploring, bringing developers together with risk assessors and trying to explore non-standard approaches that could be used in some of the assessments. And, this is more about context, isn't it? If that might be feasible in some of the risk assessment processes and contexts at EFSA, would it have some relevance in a REACH context, I think is being asked there. And it touches also on this issue of standardization, non-standard, and maybe we'll talk a little bit about that. Is that what does that mean in terms of barrier to use in different contexts? So who would like to take that? So this kind of bespoke, co-created, sitting around the table, crafting something together and then trying to apply it. A bit like the DNT emerged at EFSA, really. Maybe Bob, Luxembourg Bob, what I'm going to call you from now on.
Luxembourg Bob. It's Luxembourg Day today, by the way.
Is it?
National holiday.
Oh, right, okay. Congratulations.
Maybe I'll answer some aspects of this question. It's a very relevant question because under REACH, the burden of proof lies on industry, and this kind of collaboration between authorities and the registrants on what is acceptable and what is not acceptable is really difficult. But that is not the case in jurisdictions in other countries, for example, in the US, where this kind of dialogue and this kind of co-development is much more easy because the burden of proof lies on the regulator. And that's why international cooperation on the development of NAMs and exchange of regulatory experience in the use of NAMs at the international level is so important, because at the end of the day, it does give some I will say guidance to colleagues in ECHA to be able to say, okay, this is being used in other jurisdictions, so I'll be happy with it as well, even though they cannot say that to registrants before they register.
Yeah.
So.
I mean, we're back to the case study context as well, aren't we? I mean, as a vehicle, okay, it might be happening locally in EFSA and their scientific committees, but again, maybe Netherlands, Bob, would you like to say a couple of words about, again, the importance of case studies as a vehicle? I think during the SURAT program, many years ago when we were all working together, the case studies emerged as an interesting tool for that engagement. And then in EU Toxics, you really brought that on as part of your work program, and it features prominently in ASPIS. I mean, But of course, what was the enthusiasm of regulatory assessors and so on to get engaged in those case studies? Because that's the key, isn't it, engagement?
Yeah, in the EU-Toxis project, the learning was really in the beginning that we were hammered home by the advisory board, the scientific advisory board. Well, you need to get more regulators in. So that's where we established a regulatory advisory board, and then had from the various agencies basically represented this and telling us what we would need to do. And eventually we had actually a joint workshop at one of our meetings where we co-discussed with the regulators what would be now relevant case studies to pick on. So that not as a scientist, oh, this is a cool case study. And then you discuss with regulators, no, this is bullshit. So you really need co-design as well. And that creates, of course, also a sustainable interaction with the scientists and the regulators. And that's hard work. I will not say that everybody would be per se overly enthusiastic. I mean, for me, it's also was a learning curve to really see the benefit of it and learning the success then with the OECD reporting and also see, well, this is the only way forward then.
I mean, I was involved, to some extent in that, and really struck me, I mean, what you just said, it's hard work. It required time and commitment. You don't just build bridges and go and co-create, without some real effort. And of course, everybody's busy, and particularly the regulatory community have been burnt a few times engaging with scientific consortia and then just being blown away with science and not really having that positive engagement. So, social engineering that is a challenge in itself. But that must have been, I think, one of the few, if only, European projects that got a case study all the way to the OECD. I mean, how did from your side, were you all going, what the hell did you do? Oh, God, I mean, how did you make that happen?
Bob showed that from his, what was the UTOX risk, many more case studies were coming forward. So it is something which is really essential in pushing the envelope. I mean, having regulators take position and say, I cannot use that for these and these reasons, or I could use this if you give me these and these additional information. That is really pushing the envelope. And once again, at every case study discussion that we're having at the OECD, we're putting ECHA in a difficult situation because they cannot take position. And so that's why, once again, the international cooperation on this is so important, so that we do raise the bar on this and provide, let's say, I'm not going to say guidance, but examples of how it is being done under other jurisdictions to raise the level of comfort for everybody.
Well, I mean, we
I mean, we talk about the regulators only here, but it's not only the regulators, it's also the industry. So really get them all at the table. So it's not only academic scientists that then talk with the regulators and get understanding. It's also, get the industry then in workshop together with the regulators and discuss, what is this? And what are still the gaps, etc. So it's all the stakeholders.
I'm glad you mentioned that, because actually some of the people I've met who are the most knowledgeable at regulatory domains are actually often in industry, not in regulatory agencies per se. Rusty, engagement case studies.
I think one of the examples that we have, right, it's a case study that in the Accelerating the Pace of Chemical Risk Assessment, right, that you participated in, Tomasz participated in, and it really, one of the first case studies, we had the first APCRA meeting, and one of the case studies was really sort of what we call the retrospective case study, where we were evaluating this concept of prediction versus protection, right? And, it took longer, right? It's not something that when you work together across different regulatory jurisdictions and regulatory agencies, as well as the research offices and directorates that are supporting them, right? It takes longer. But through that case study, we really were pushing the envelope and sort of co-learning this concept of protection, right? What does it mean to be protective? And can you assemble combinations of NAM to illustrate that protection? And I think through that case study, we all learn together in terms of that concept and really pushing that idea of protection versus prediction and how do we get there as a larger regulatory community.
Yeah, very good. I wanted to move at the time we've left to another important keyword, uncertainty, and linking that to acceptance. I won't read out the whole question, but that's the first point. Let's talk a little bit about uncertainty. I think it was Tomasz, you mentioned about still uncertainties, just unfamiliar uncertainties. But then linking that to acceptance. And so acceptance in the broader sense, societal acceptance versus more regulatory acceptance. And then this idea of, in learning from other sectors. Could you move? It's Ubert, isn't it? Ubert. I can't see who then. I think it's Ubert too. I know. He also is asking, in other sectors like the pharmaceutical sector, you have post-market follow-up. If you assume your system is imperfect, you try to make it as perfect as you can, but you assume it isn't, and then you have some provision to follow up and see where you might have got it wrong. So who would like that? Two elements of that around uncertainty, reducing uncertainty, getting more familiar with NAM-type uncertainties, and then the broader sense of acceptance. I mean, Katrin, from your perspective, the broader sense of policymakers feeling comfortable, feeling confident, and what have you any insights there?
It's not the most easy question for me, I admit, maybe for nobody. I think uncertainty is an area that we need to try to address with comparing information that we know, as Tomasz had alluded in his presentation already. And I think such information will greatly decrease uncertainty, but probably it is also just a fact of life and the realization that we cannot remove it entirely, and that there's probably some limits to the ambition we can have in reducing it totally.
But it doesn't mean we can't deal with uncertainty, and I think that's well established, isn't it, through different means of safety factors or whatever, but equally scientifically we can really characterize uncertainty. I mean, look at all the work that EFSA has done over the years on very excellent guidance on how to identify sources of uncertainty and so on. Bob? Yeah.
Sorry, very quickly. Uncertainty will always accompany us in all the work we're doing on the regulatory use of NAM. And we continuously need to put it into perspective about what's the uncertainty of the current system and what's the uncertainty that we can accept compared to the current certainty of not knowing anything. So that's we need to keep that into perspective all the time.
But that's really important, isn't it? It's again the problem framing, because if you're just zooming in on that, how does it compare with the ECHA? Then the perception might be it's somehow more uncertain, less protected. But if you put it in the broader context, like you were saying, Rusty, but maybe we can have, somebody said, a bit more data on a lot more chemicals where we can begin to flag the real bad actors, as opposed to looking for, and maybe it's delusional. We will never be certain about anything. We just need to do our best. Anybody want to talk to that, Bob?
Yeah, we are certain that we have now no knowledge. That's our certainty now, right? And we have certainty that we have a lot of NAMs basically in a toolbox. So that's our certainty. What we are uncertain on is maybe what the performance is of some of them. But definitely if we use them, despite the uncertainty, we will create higher certainty for our current uncertainties.
Yeah, so uncertainty budgets, we need to start formulating those. Tomasz, you wanted to come in?
Yeah, regarding uncertainty, I think there are two elements of it which we should tackle. First is the setting up right expectations and separate the different problems, and then trying to demonstrate for each separate problem how NAMS works in comparison to the current system. You can do it. And this is probably when you start to gain confidence and you start to see, actually, this may work. But this is the process. And basically, the best way is really going through the real cases, through the real applications, and trying to see how it works, where are the struggles, where are the problems, and where it could be already applied. And just briefly, very briefly, I wanted to come back a bit to the standardization issue and so on. To paraphrase one of the famous professors in the QSAR world, NAMs are not for pedestrians at the moment. The level of scientific excellence which you need to have to cope with NAMs is enormous. That's why NAMs are at the moment developed or by the biggest industrial companies or the best universities and the best governmental programs. So we need to find a way how all this excellence and how this knowledge can be converted to something robust and direct, which every registrant can cope with, and every regulator can easily make decisions based on that. And this is probably one of the key problems, because one of the problems I think when Bob or Rusty is coming with those presentations, you see all those beautiful omics, all those beautiful graphs, all those gazillions of different data, different approaches. I think many regulators are scared. My goodness, I will never learn how to do it. I will never learn how to make the real risk assessment decision based on that. You need to think how convert all this excellence and all this experience into very robust, very simple approach when everybody can deal with it.
Yeah, that's a very good point. Rusty, I'm going to give you the last word because you've traveled the furthest.
Yeah, that's a danger. So I guess, in addition, I like Tomas's point, but there's in addition a facet to uncertainty that I think we need to understand, and this is something that we've been at least asking a question about lately, and that is there's uncertainty, right? And I agree with Tomasz is that with NAMs there's probably a different type of uncertainty than what we've been dealing with, right? But characterizing those. But the other facet is that is the issue of timeliness, right? That we need to factor in, right? Are we willing to, and in certain cases, are we willing to trade off a slightly greater uncertainty with whatever models we are using if we're getting the result faster? And when you do the comparison of that, right, actually you're far ahead from a public health standpoint, as if you're willing to make a little bit more uncertain decision now than waiting 10 years for a more certain potential decision on a particular chemical, right? And so understanding what you're trading off by waiting for that information and attempting to make a potentially more certain decision, there's consequences to that, right? And so we need to factor that into how we're developing or how we're characterizing uncertainties, right? And the trade-offs we're making associated with that, as well as the validation processes and everything else we're layering on to make the delivery of that results occurring farther and farther in the future. So again, just not just uncertainty, but also the timeliness of that decision-making process is critically important to how we're thinking about new approach methods.
Excellent. So we're back again to a much broader framing, almost a public health economics framing, which would be very helpful to explore, wouldn't it? Assuming that we have 150 methods already developed with plenty of methods. Okay, we've come to the end of our discussion. Please, can we put our hands together and thank our speakers, panelists? Great, welcome back, everybody. Hope you enjoyed the coffee break. Plenty of lovely, great chats going on, which we've missed for such a long time. Okay, we're moving into the second part of our session, and it's as exciting and action-packed as the first part. We're going to, we heard a lot about roadmaps and plans of action, and we're going to talk about that now. As you know, EFSA has been working with external consultants to develop a roadmap for bringing NAMs into play in chemical risk assessment. And we've got Sylvia Escher here from Fraunhofer, who's representing the consortium. And Sylvia is kindly going to present their findings so far. I wanted to emphasize, and Sylvia will probably do it as well, that this is still work in progress. It's obviously progressed to the point where it can be presented to us. But a very important objective of this session is to get some feedback on what's being proposed. The panelists later will be discussing that, among other things. And again, all of those of you out there in online land, please post comments about the roadmap if you have any. And we'll try to maybe pick some of them up in the panel discussion as well. Sylvia, stage is yours.
Okay, oops. Thank you for giving me the opportunity to introduce the EFSA roadmap project to you. This was done in cooperation with 5, so I'm here on behalf of 5 different partners presenting the outcome of our work. And this includes DTU, and Susanne is also with us today, RVM, Free University, Euroconsult, and Fraunhofer ETM, where I'm coming from. So the first slide, so to say, again, summarizes what we have heard this morning, the risk assessment, the present and the future. And here I just summarize that at the moment we are, so to say, interested in hazard characterization by doing mainly animal testing, and here we have adverse effects in certain target organs, and from there we then extrapolate to the human situation with the goal to make our life safe, so guarantee human safety. And now we are moving, so to say, into the future perspectives, and here we want to do hazard characterization in a kind of different way, where we combine evidence from different NUMs, new approach models, and here we can think about different in vitro assays, but also in silico approaches. We heard about the AOP, adverse outcome pathways, and so on and so forth. And then the challenge is to integrate all this evidence into an integrated testing and assessment strategy, then also come to a conclusion about the hazard of a certain compound, and then extrapolate to the human organism. So this is, so to say, the future. And the NUMs come with a lot of different promises. So here we think that we can integrate mechanistic evidence, so better understand where the toxicity comes from. At the moment, this is not always possible. When we think about endpoints like systemic toxicity or repeated dose toxicity, where we rely on the apical findings in our in vivo animal studies. And also another promise is that we can address and quantify differences in human susceptibility a little better by using human test systems. So this paradigm shift also has a lot of opportunities, as briefly listed over here. So we think that we can improve the mechanistic understanding and have more human-specific models. And we will also go into the direction of the 3 Rs, reduce, refine, and replace animal testing. Then we will speak a little bit about challenges also in the coming slides. So challenges for the NUM testing includes the robustness and reproducibilities of the assays. We would like to learn better sensitivity and specificity and also predictivity to a certain toxicological endpoint. And we have the challenge of data integration. The regulatory challenge is limited experience with NUMs, as we have heard this morning already. It is multidisciplinary, so quite a complex approach. And we have uncertainty of this approach, and we have to understand this. We still have knowledge gaps, and we see this on the following slides. We still have to learn about the relevance to toxicological endpoints, so it's probably endpoint specific. And an open question is also, what is good enough? What is the scope of our NUM testing? Where to start and where to end NUM testing to come to a conclusion in regulatory risk assessment. We also heard already this morning, so I'm repeating a lot of things that have been discussed already, that we have 2 different approaches. We are speaking on the one hand about the evolutional approach, where we still have the animal data as a gold standard, and when we use NUMs as supporting evidence to, so to say, support our current risk assessment methodologies by more mechanistic data. And so this is the integration of NUMs together with in vivo data. And then we have the revolution where we think that we can base all our assessments later on human evidence, and then the animal data would not be the gold standard anymore. And here we will place, so to say, in vivo animal testing. And here we heard already that we can distinguish, and we did this also in our roadmap report, predictions, so predicting the type of toxicity and threshold derivation, from protection, where we only want to have kind of safe threshold without probably understanding fully the different mechanisms of action. What did we do in our EFSA roadmap project? So we did not, so to say, scribble down what we are already knowing, but we did a kind of systematic approach. First of all, we mapped all relevant projects and ongoing activities to learn what is already available. And then based on that, we identified data gaps, so research topics requiring further scientific development, and also challenges and blockers with regard to regulatory implementation of these new methods. Based on that, we prioritized working areas and research activities and proposed a list of concrete activities that can be followed on to really implement NUMS in the near future and also in the longer term future. Longer term goal, yeah. We paid specific attention on what we here call regulatory readiness. And here we can see in green, so to say, the usual process by which NUM, so to say, would enter into regulatory implementation. This starts from research and development and then goes through all these validation steps to, in the end, end in an OECD guideline and then get into regulatory implementation. But here we are speaking about not yet formally validated NUMs, and therefore when we thought about regulatory readiness, we included, so to say, one additional category, which we called in situ validation over here. And what do we mean by that? These are NUMs that have already been moved one step beyond research and development, so they have been used in case studies with a clear regulatory problem formulation, and regulators have already, or toxicologists have already assess whether or not these NUMs are useful for regulatory implementation. So a case study used for validation. We also, in the EFSA roadmap, proposed 2 different steps of implementing NUMs into regulatory decision making, and here we distinguish 2 different steps. First, the knowledge development, and second, the knowledge implementation. And for the knowledge development, I think we also heard this in the panel discussion, the previous panel discussion. We here propose joint case studies with a clear regulatory problem formulation to gain confidence into the performance of these new approach methods. The challenge is still that this new next generation risk assessment is complex and multidisciplinary, so you have to engage with different research groups and different research areas. And so we have the challenge to bridge the gap between all these researchers that are interested in excellent science and the toxicologist who is in general interested in safety of humans. And these case studies are, in our view, an excellent tool to come to this, to bring both, to say, together, to gain confidence into this non-formally validated new approach methods. And as soon as we have, so to say, then developed a concept which NUMs to use and how to integrate them and learn this in these case studies, then we can think about knowledge implementation, and we saw EFSA as a central player in this process. Therefore, there is a line directly to EFSA, and EFSA, we think that it would be a good idea to then promote this cross-sectional within EFSA and EFSA communities like EFSA working groups and panels, and not only to disseminate this and implement this within EFSA, but then also to reach out to national, international organizations. And here we mention, for example, ECHA, OECD, SCCS, PARC, and so on. So during this work, after data gap identification, challenges, and blockers, we prioritized 7 research areas and an engagement plan, and you can see them over here. So we proposed actions for AOP and AOP networks, EV-PPK modeling, exposome, data integration, advanced cell culture systems, in particular organ-on-chip systems, and in the area of susceptible human population, and new concept for risk assessment. And in the end, a tool, so to say, for the engagement, which is called Forum, and we will come to that in a minute. Per research area, we proposed 3 to 5 research activities. These are depicted here in green. So the research areas are depicted here in green, and we have 3 to 4 research activities in there. And you can see that many of them are interlinked. They are not only coming from one of the research areas, but they are coming from many research areas, so it's not it's already a complex and interlinked process. Then we discussed these research activities in a workshop with stakeholders and also picked up the ideas from the workshop into the roadmap report. So here are our, so to say, 7 prioritized research areas and the different actions, and the forum, which is, so to say, the engagement plan. And I thought in 20 minutes probably not doable to talk you through all of them. Therefore, I picked it now 3 examples, and I will talk you through these 3 examples, but the report is online and published. You can have a look if you are interested in even more details. So we start off with the development of AOP and AOP networks. This is clearly located in this approach, the evolution, so better mechanistic understanding. What we can see here is the mapping of all the models and tools that are already available. And here we map, so to say, all AOPs and IATAs that have been published or OECD endorsed for different endpoints. And you see the different endpoints over here, like STOT-RE, I can't see it anymore, non-genotoxic carcinogenicity, immune tox, endocrine disruption, DART, and developmental neurotoxicity. So you see that in these different areas, the tools that are already available differ between orange and green, and the more green it is, the higher is the regulatory readiness level. You can see very easily that, for the area of immune toxicity, there's hardly anything existing. In other areas like STOT-RE, so systemic target organ toxicity, specific target organ toxicity, we have a lot of green bullet points. But nonetheless, when we look into the details, we concluded, we have already a couple of AOPs in this area. They are very often liver-specific, for example. And they are also OECD endorsed, so kind of regulatory readiness level has been achieved, but overall the coverage for the whole endpoint is low. We are not speaking with STOT-RE only about liver and kidney toxicity, we are speaking about systemic toxicity, and that might arise from many different organs and many different mechanisms. So here we see a need for further investigation and also a need for more AOPs. So these are the activities that we propose. In a series of case studies, either being launched directly by EFSA or being reviewed from, let's say, mature European projects, we propose to develop prioritization guidance on the development of AOPs and AOPs networks to better prioritization of AOP networks of regulatory relevance for human health and risk assessment. We also propose to set up methodologies and guidance and tools to support AOP development. And here we are thinking about artificial intelligence and systematic review techniques. We also propose to develop prioritization guidance on the assays that we need to have to address all these MIEs and key events in the AOPs, which are of particular relevance for food safety and to reach a sufficient validation. And also, we recommend to explore the possibility to further and better integrate omic data into AOPs, as well as mapping existing pathways also to evidence from clinical data. The second area that I like to mention here or to highlight is toxicokinetic assessment. So in the first example, you have seen that we mapped what is already existing and the regulatory readiness. And in all cases, we also identified data gaps. So here we jump directly to the data gaps that we have identified. And I will not talk you through all of them, but what we see here is that we have identified that there are not so many reference in vivo ADME studies for chemicals and substances that occur in feed and food. So it would be beneficial to have them for the quantification of uncertainty of PBPK models. We also say there are not so many well-characterized in vitro ADME models and data. So this is a data gap. And also absorption, permeation, accumulation in barrier organs is a data gap. Metabolism in the quantification of metabolites is a data gap. The microbiome is a data gap. Active transport is still somehow a data gap, but there are already some approaches. And also the sensitivity analysis, it has been described how to do it. There are a few case studies about this, but here we have to gain more experience and also to learn how to use this in regulatory decision making. Therefore, we propose two different actions here. On the one hand, the development of advanced in vitro ADME models to really assure that in the end we can have generic PBPK models that are independent from in vivo animal data. And to support this, also the development of an open access reference database with in vitro and in vivo ADME data and models. Then we will quickly look into data integration. So the other area that we explored is challenges and blockers preventing regulatory implementation of these NAMs. And here we, so to say, found out by reviewing the public literature that one of the biggest hurdles is the missing concept of an overarching framework for data integration. And here we are speaking, for example, about omics, but we are also speaking about a consensus about the integration of NUMs overall. It's not specific to omics. So we have not accepted, today we have not the accepted regular performance standards for NUM data, and this is, so to say, needed to come to a conclusion not only by one single toxicologist, by so to say, an agency. Here, for example, also the propagation of uncertainty is an open issue, and we speak here probably about acceptable levels or something like that. So data integration approaches to conclude on safety assessment is missing. It is actually not missing, and this is described in very much detail in the report for all the different specific NUM building blocks, like for specific in vitro assays, for omics and things like that. There's a lot of guidance how to document and how to assess them, how to come to a conclusion. Here we mean really the integration, evidence from many different NUMs into an overall framework, and then come to a conclusion. Therefore, also here, we propose a series of case studies to develop a consensus about the criteria and standards for NUM data to support decision-making in a risk assessment. We also said this is a series of case studies to develop a tiered approach for testing and assessment. Also following the idea to start with something simple and come to a conclusion, and only move to something more complex if really needed. In this context, it's also advisable to develop templates, reporting templates, to guide the user and the applicant in the end to document the NUMs properly and to come to conclusions. And also here we say, at the moment, we have already the weight of evidence approach to deal with all kinds of in vivo data. This would also be beneficial to have something very similar for NUM-based approaches. Yeah, and this is, so to say, the last point, the engagement plan. So here we call this a forum, and so the new aspect in it is, at the moment, usually when we, so to say, developed a guidance how to use data, how to integrate data, then we put this into a publication, and then everyone can read it, and probably we are done. But we thought in this complex and multidisciplinary approach, it would be very beneficial to have something more interactive. So really a forum that, or platform that provide access to the learnings and the workflows and the tools that we use to come to decisions. So, and for sure also a cross-sectional guidance document, but not only put it on paper and then leave it there, but having someone also responding to questions, having hands-on examples, things like that. And we think that this interactive dissemination will help to bridge the gap and to implement these new models a bit more straightforward compared to guidance documents alone. This is, so to say, the table of all activities that we proposed in these 7 areas, plus the engagement plan. I will not read it for you, because, but you can find this in the publication. Here we prioritize them according to the regulatory readiness level, as I told you, so the greener the better, but also with the potential impact on daily risk assessment, so what, so to say, is achievable right now and what is achievable later on, so costs and timing. Yeah, and you have seen that for the few ones that I have, so to say, highlighted. And by this, I'd like to thank you for your attention, and probably the biggest thank you goes to the project team. And here you see all the people who were involved in the development of this roadmap. Thank you.
Okay. I can take it. Thank you so much, Sylvia. There's a lot in there, but some very, very relevant things. I'm sure people have taken note and want to comment. So we're going to move now to our panel discussion. So I'd ask the panelists to take a seat. Also, Sylvia, you're going to join us on the stage. Carl. That's right. I was told to sit there. It's not my favorite seat or anything. Okay, very good. Super. So what is this panel all about? Well, as I said, first and foremost, to reflect on the the roadmap or the draft roadmap that was just presented. But also we wanted to get some insight into the panelists' own views on the roadmap, but also on their own experiences implementing of NAMs and some suggestions, and ultimately really concretely how you think we can make future progress. But first, let's meet our panelists. Just want to check, we were meant to have an online panelist. No, we don't. Well, that makes my life a bit easier. So let's start in alphabetical order. I'll ask the panelists to just introduce yourself, your affiliation, and what your day job is. So, Carl.
Hello. Yeah. Hello. I'm Carl Westmoreland. I work for Unilever in the Safety and Environmental Assurance Centre there. We're responsible for safety assessment of new ingredients and Unilever products, and a large part of my role is in how we do that without animal testing. Maurice mentioned the cosmetics products regulation earlier on, so we've been living for the last nearly 10 years now with that in that environment of how we assure safety without animal testing. So that's me in a nutshell.
Thanks. Julia.
Hi there, so I'm Julia Baines. I'm with the Peter Science Consortium International, and essentially a lot of our work is based on regulatory testing with stakeholders, with ECHA, ECVAM, OECD, and so we do a lot of work under the chemical strategy for sustainability, particularly REACH as well is one of our big focuses, and its interaction with the cosmetics regulation. So our main focus is about promoting the implementation and development of NAMs.
Thank you, Julia. Marcel?
I'm Marcel Leist. I'm professor of toxicology at the University of Constance and have been really dedicated to NAM for a long time because that's the denomination of the chair. And for instance, we have developed in vitro test battery for DNT, which has been mentioned several times. So we have intensive contact also to the regulatory needs.
Excellent. And Michael, last but not least.
Yes, thank you very much, and good afternoon, everyone. Yes, my name is Michael Empel. I work in the Veterinary Pharmaceutical Service of the European Medicines Agency, and before that, I have an academic background. I used to work in toxicology, did a lot of 3Rs, development and research. And now I mainly work in safety of veterinary pharmaceuticals and consumer safety, but I also am one half, so the veterinary half of the joint 3Rs working party of the agency. Thank you.
Excellent. Well, welcome to you all. Thanks for joining us today. So look, we've heard from Sylvia what's been proposed, very much an evidence-based exercise with the 7 proposed research areas as well, but also some talk about the engagement planning. And so, I mean, let's go to each panelist a few minutes to give your own perspectives, and we'll take the same order. Carl.
Thank you. So I really wanted to start with a thank you to EFSA, really, for doing this, embarking on this endeavour and producing this report. I mean, I found it fascinating. All 150 pages of it. But seriously, I do think that there were I've got 3 main points. My first point is on that overall congratulations for starting on this endeavour, really, because there were 1 or 2 sentences in the introduction that I thought, absolutely, yes, working in this field. I wrote them down. It's like there's a lack of consensus on relevant NAMs, and there's that the overall landscape is fragmented. And I absolutely agree with that. And I think the NAMs have come on at such a pace, particularly in the last 10 years, that those of us using them have developed frameworks for their use, and as have the ASPIS projects, the SURAT project, ESOTOC are working on that. Each group looking at how NAMs are used for their purpose, for their use in decision making. And I think really stepping back and looking at those frameworks and what consistency we could bring to those for decision making, rather than always focusing on the specific NAMs themselves, but how it all features in decision making, be that food safety, be that REACH registration, cosmetic safety, whatever, I think will be really, really valuable. My next point was I loved the emphasis on exposure. The sections on PPK and the exposome, I think when you're making safety decisions on materials that humans are going to be exposed to, You can't do that unless you know about the exposure side of things. Hazard and exposure always come together in risk assessments. And we can't imagine that NAMS data slots in with traditional exposure data. When we're evolving our risk assessments, we must evolve both the exposure and the hazard side of it. And I think that's been one of the biggest learnings over the last 10 years in the cosmetics industry, is how much exposure science has changed and how much our risk assessments now depend on estimations of systemic exposure rather than the mg per kg in a human versus a mg per kg in a rat thing that we used to have. I think that has been the biggest change in the cosmetic space, and the fact that it's so prevalent in this EFSA roadmap, I think, is fantastic. And then my third point, I was allowed 3, is that part on the new concepts in risk assessment. Again, I think, and the forum sounds fantastic, I think the whole discussion earlier on about protection, not prediction, how that might feature in frameworks for risk assessment of the future is vital that we explore that more. Again, in the cosmetic space, the change happened when we moved from how do we do this animal test without an animal to how do we make the decisions on consumer safety without using animal data. 2 very different questions, and I think that posing the right questions for the future of NAMS in risk assessment is going to be really important. And I think the whole the working together, the collaboration aspects will hopefully be very fruitful, and I hope that those of us who've been working with NAMS for quite some time in decision making, potentially in different areas, but if we can share what worked with us, what hasn't worked with that, mistakes we've made, learnings we've had, in amongst that evolution, hopefully that will be part of the journey.
Wonderful. Thank you,
Thank you.
Carl. Julia, can I pass to you?
Great, thank you. First, just say congratulations as well to EFSA on probably one of the most comprehensive roadmaps I've ever read. And what I really liked about it was the fact that it's really building in some aspects on confidence building. And I think that's something that we've touched on in this morning's session, where we've been talking about our uncertainties, for example. And I think one of the things that maybe EFSA could think about is a PR consultant for NAMS, because we really need to reframe how we talk about and how we conceptualize NAMS, because let's remember, NAMS aren't new. They're not new methods often. Some of them are decades or at least decades old. And actually, it's just their integration into regulatory frameworks which is new. And that's a shame, because it shouldn't be new for some of these methods. It has moved at glacial pace. And so perhaps we need to be thinking about the way in which we frame NAMS. And to give one point of example was the recent REACH refit public consultation survey, for example, that had very specific questions that you could almost say were undermining the value of NAMS. Talk with questions, for example, like, would we accept replacing animal tests if it meant less protection for humans? And it's like, well, actually, that's not the case, because as we've heard from Rusty, for example, this morning, the mechanistic value and what Carl was just saying, the scientific progress that has been made with NAMS, we need to be talking about this, and that this is a step up. This is a step forward with science. Let's not go back down that timeline that Morris was talking about this morning. We need to be advancing. So that moves me really to my second point, that under the chemical strategy, the R&I agenda really shouldn't be just limited to just the safe and sustainable by design concept, but actually we need under the chemical strategy some overarching concepts and points, some goals and targets that are really about accelerating forward the application of NAMS, because we already have lots of great projects. We've already heard about Horizon, for example, Park, Aspis, but we need to make sure that we have a joined up approach, that we have a holistic approach to our acceptance and our implementation of NAMS. So let's try and avoid the NAMS silo. And no offence, Morris, but we don't want NAMS to just be shifted off to ECFAM and saying, there you go, ECFAM, here's a new NAMS approach, go and do your validation. And again, that then brings me to the third point, is validation. It's something that was touched upon this morning. We need to rewrite the rule book on validation, because the way in which NAMs are developed doesn't necessarily mean, and they shouldn't be, directly compared to the animal methods. And it was already mentioned this morning, I think it might have been in one of the questions, that animal models are often seen as the gold standard, but in my view, that gold standard has got a lot of rusty spots on it. You know, we do need to accept, we talk about validation for NAMs. Well, let's talk about validation for some of the animal methods, because there are some that are in use and are accepted, and they have not been validated to the same standards that NAMs are now. And we should be holding these methods up to a high standard. Of course we should, because we need to make sure that we're using the best science, getting the best data for making the most appropriate regulatory decisions. So let's not get stuck in this kind of silo approach where we don't have this joined up holistic assessment. But indeed, let's kind of think about how we might rewrite that rule book for validation by thinking about the technical capabilities, the characterization of NAMs, and looking at it in reference to human-based biology to make sure that we've got relevant data points. Because as we've heard as well from Katrin, we are expecting animal testing to go up, and that is likely to be significant. But whilst we are having increased hazard classifications, for example, we're going to have new categories, inhalation sensitization, for example, neurotox, endocrine. These are all areas where we are at significant risk of increasing animal testing, but the animal methods are not necessarily there. Yeah, inhalation sensitization, we had an AOP that was published around 5 years ago. I'm not saying we're there now with NAMs, but we have the starting point. So let's work on some of these small points to make sure we accelerate those particular areas rather than go into a default position of, well, let's just see what we've got and have some data, because it's not necessarily the best data.
Thanks, Julia. Marcel, you're up.
Yeah, thanks first to Julia and Carl, because you anticipated already some points. We didn't pre-discuss this, so I can be shorter, which is nice for the audience. I'm not a native speaker, so it won't sound so nice. But I have perhaps a little bit different perspective. So we have this roadmap, and I want to congratulate. It's really nice. So the paving and the construction of the map is nice, but I'm not sure whether the endpoint is so clearly defined. So we have the road, but not the goal, and this is what Julia indicated. Perhaps we are overdoing this. It's too shiny. Perhaps we are over-ambitious. And as an academic, I am very much forward towards always pushing standards, improving things. But we should also see where we stand now and what this road is kind of trying to achieve or to overtake in terms of animal experiments. And validation has been invented, kind of established for NAM, because it didn't exist before, and the animal experiments are usually not validated. And there is quite an elaborate structure and theory on validation out there. And it has also been applied in many cases. So it's not a total gap. The same applies to uncertainties. Of course, every method has uncertainties, but animal data have not been scrutinized so much. The National Academy of Sciences of the United States has set up now a committee because they realized this gap. And the first studies coming out show an amazing heterogeneity of the data from animals. And we can go on. There are some funny points like the microbiome. Of course it's important, but we don't really think that the microbiome has been addressed by animal studies. So we can go further and it will be important, but this road will lead us much, much further than where we are at the moment with the animals. And data integration also sounds complicated. So of course the outcome of the methods needs an interpretation, but then we also need to understand a cell culture is not a method. And an omics approach is not a method. They are an endpoint of a test method. The test method has a prediction model, and that has been established in the field of NAM very nicely 20 years ago. And the prediction model says it's toxic, it's non-toxic, or it has a 30% probability of being toxic if we go to probabilistic risk assessment. So a lot of these things do exist. And if we go to animals, we don't have this big integration problem, but we have the problem of the deconvolution. So there are many, many endpoints in each study. So in a reproductive study, there might be less embryos found, or the eye opening is half a day delayed, or the embryo weight is different. So we don't need to integrate the data, but we need to take them apart and decide whether they are of any importance. And here the field hasn't provided a prediction model. So congratulations, Sylvia, of course, and all the team to the roadmap. I think it will lead us to a better toxicology, but it will be far better than what we have now.
Thank you, Marcel. Great words. Michael, over to you.
Yes, thank you very much. And I'd like to congratulate Sylvia and her team as well for a very, actually one of the most comprehensive reports on NAMs and availability of NAMs actually I've read. So in that sense, I can only reiterate what my colleagues here have said. It's really comprehensive and shows a way forward. That being said, obviously it's tailored to EFSA and EFSA structure, so I may give a little bit, the pharmaceutical or medicines perspective here. And I'd figured instead of talking about, the specific details of the report and the development of the different NAMs, I'd like to give you a little bit of an insight of maybe hands-on experience we have at the agency working with NAMs and discussing NAMs with stakeholders in order maybe to inspire you, perhaps, to take up some procedures that might lead to a quicker uptake. Because when I read the report, a lot of the methods described are at a very early stage or at an early stage and not really there yet for regulatory uptake. So I'd like just to give you 3 points or 2 or 3 points on what I think maybe would make the uptake quicker than official uptake at OECD or even ICH, VICH level. So the first one I noted down was cooperation. So I really think that on a European level, but also on an international level, I think regulators all together need to cooperate on common standards and discuss really what they expect from NAMs. And all the things we heard also in the first part of the session, set standards, etc. So all of this, I think, needs to be discussed at an international level. The good thing about this is it will also give industry a kind of regulatory security, if you like. If there are set standards, that could help the uptake of method and the use of method by industry, because they will have a certain certainty of taking up methods. And also, I guess this is a bit of the spirit of the whole conference, this One Health approach, and also in the frame of the chemical strategy for sustainability, the One Substance, One Assessment part of it, for example. All of this, I think, is in the spirit to kind of cooperate and maybe get to common rules on how to implement these NAMs. And that said, there are, of course, differences between the medicines, legal framework and assessment and, for example, food or chemicals, yes, but the underlying toxicology and the assessment part is very much similar. So there are not that many differences. The outcome may be different, yes, but so I think cooperation in permanent also fora, for example, not only within research projects funded on, in Horizon projects, but really in fixed fora, maybe at ECHA, maybe in other institutions, where all these regulators can come together and discuss, their standards. So that was one point. So the other point, and this is more of a bit of a practical example of what we've set up at the agency, is stakeholder engagement or early stakeholder engagement. So probably some of you read it. The agency has this so-called innovation task force where you can have an early engagement with the agency. And recently this was opened up to 3 R's methods, so independently of medicinal products. So everyone is welcome, from academia to companies, to actually apply and discuss with the regulators, even before a method has reached pre-validation or even regulatory acceptance state, to discuss with the regulators this method in detail, to get feedback on what is needed, what could be improved. So all of these things I think are very important also there to kind of stimulate the use and give feedback to the developers of these methods on what regulators actually want. And then there's this other thing that is within this so-called scientific advice procedure, which we call, for the human part, qualification of novel methodologies, and on the veterinary part it would be also scientific advice. And this is a bit a more formal procedure where a method developer could go to the agency and ask for formal qualification. So before a method is actually really integrated into an international guideline, ask for a case-by-case qualification and validation of that method. So in that sense, I just like to give food for thought, maybe that these kind of procedures of early engagement and maybe discussion and maybe also formal qualification of methods independent of OECD or other guideline uptake could maybe help in actually reaching, for sure not for all methods, but maybe for some. And already if we can integrate certain methods or some few methods, that will already be a very good way forward, I think. And the last point is, but this is maybe not something necessarily for the roadmap, is I think generally I think that's what I at least see, is there's a lot of things going on out there. So a lot of research is being done, a lot of methods being developed, but they never reach the regulators really. So we can maybe discuss later the reasons why this is. So I think there's a real gap between what regulators see and what is actually given to them for assessment, and then what's done outside. So this needs to be overcome, and I think the quicker this goes, the better, and the more flexible this goes. Also here, rethinking maybe paradigms of validation and other things that have been said. So in that sense, maybe also, but this is just a personal thought I had, maybe regulators could make a leap forward, for example, and publish, for example, guidance on different criteria, giving again, for the implementation of NAMs and what they expect from NAMs, giving again more incentive and more detail actually to method developers on what regulators actually need for method uptake. So I'll stop here.
Okay. Thank you, Michael. Before we move to the next, I just wanted to give maybe Sylvia a chance to respond to some of the points. Maybe just cherry pick a couple. You don't need to be comprehensive. There was a lot to take on board there.
Yeah, probably I don't remember everything. But I think the last thing that Michael mentioned is something that we try to pick up in our roadmap, which is specific for EFSA and which is specific somehow for food and feed safety assessment. And here we have this concept of these work together with researchers, define your problems, the real problems that you have in your daily risk assessment, then design, so to say, a solution in these case studies, and then learn from these case studies. So not only the regulators learning from the scientists, but also the scientists learning from the regulators to come closer together. And as soon as then we have learned it in a couple of exemplary approaches, then we can go ahead and derive guidance. So this is an aspect that we are also promoting, but we are also thinking about, and it has another name, so probably we can even harmonize this. And yeah, why don't we look into other areas like drug development to see what is happening there. And also in the forum, I forget to mention it, there are also one aspect of it, not only, so to say, to disseminate what has already been done, but also for people to bring in new ideas was also one of the aspects. So really have an interactive and open, so to say, connection to, in this case, EFSA, so that EFSA gets also aware of new approaches and also new collaboration opportunities. So
thank you, Sylvia. I'm going to ask the panelists in a moment about what they might have picked up from the presentations this morning, and one particular point. Before I do that, I wanted to jump to a comment from Maria Arena, and it's funny, it's in my notes, Maria. What about ecotoxicology? Why are we all obsessed about human tox this morning, apparently? Last I checked, we needed to save the planet as well. And particularly if we think about just the Commission launching loads of initiatives in restoring biodiversity, protecting our environment. I mean, NAMs surely are as important. And I would go as far as to say, I think we've a lot to learn from the ecotox community and the environmental risk assessment community, who have often been far more innovative in creating frameworks and applying. So, Carl, I'll go to you, because I know in your backyard that's important to you.
Hello? Yeah. Yes, I've talked primarily about human safety, because that's kind of the area I work in, but the group that I work in SEAC and Unilever has an environmental safety side as well. And absolutely, I think you're right. The whole, how do you do environmental safety assessments in a different way? There are things to learn, because obviously they are looking at an enormous number of species compared to the one that we look at. And some of the advances, there's been sort of advances in the isolated fish gill assays, etc. And then that's developing on to more, how do you use transcriptomics in that for more long-term effects. So absolutely, I think that whole, how also, when you're finding out fundamental things about mechanisms of toxicity in our group, some of the things you find that are relevant to human safety are also relevant to environmental species. So integrating those two more closely, absolutely.
Yeah, I mean, this is a One Health conference, and I mean, what about one toxicology? If we've gone to the mechanistic paradigm, we've recognized that pathways are conserved across speed. I mean, look at the endocrine area. So as opposed to just learning from each other, could we not contemplate actually? One of the ASPE's projects, Precision Tox, is all about phylogenomics, is actually using understanding of genomics to really predict how cross-species sensitivities and so on. So maybe that's something we could bring into the discussion as we go on. Okay, well, so I decided I wanted to jump to who would like to talk about something they heard this morning that really caught their attention, that you'd like to elaborate on. Marcel.
Perhaps to take, there were so many things.
Yeah, I know.
It's hard to discuss, but since we are all together, and for some of us the first time since a long time, it's also a social enterprise, not just scientific. And I think we also learned in the past 2 years about social bubbles, social network bubbles. And we might smile on that, but probably we are all into some kind of a bubble that also is an information bubble. And there are crazy things sometimes happening in this bubble, so people thinking there's no virus. But there are also small deviations or small changes of perspective. And I got this impression so strongly this morning when I heard more the left-hand side and the right-hand side, that I feel, from my point of view, for instance, regulators are in a bubble. They see another world than we are seeing. So Katrin mentioned that NAM are not predictive for adversity. And this is something that came up last year, and I've never heard this sentence before. Since then, it has been reverberating, like in these social network bubbles. And now it's coming back as an argument, where 20 years this was not a problem, and it's very clear that NAM are predictive. So the ones that have been used for 20 years in mutagenicity, they predict very clearly adversity. And if something is done for skin irritation, for eye irritation, it is adversity. And also in a complex field like endocrine disruption, what Nicole Kleinstreuer has shown and Rusty Tomasz is, of course these things predict adversity, and they do it better than the ultrotrophic assay. So, but people live in a bubble, and they think the methods are not validated, and they might not be predictive for adversity. And this is, again, perhaps from my bubble. But that's why I'm mentioning the point. So we come together here, and this is the value of this discussion and the exchanging. We need to talk and talk and talk, and see that the bubbles kind of penetrate and find a common consensus. So that was my strongest impression from this morning.
Well, thank you for that, Marcel, because it touches a bit on what Michael said before, too, about fora for engagement. And often it's simply, we're not aware fully of what progress has been made. I mean, you talked at the OECD, there's a big initiative this year to organise a whole series of webinars, but also a workshop on the 1st and 2nd of December on emerging technologies and how they can be taken up in risk assessment. And the OECD covers cross-sector. And a lot of OECD guidelines are used in the pharmaceutical sector. So, I mean, there's something that's going to be open to the public, and again, in an attempt to have that discussion. And I mean, funny, what caught my attention sometime was a GLP discussion. How many times did we hear, oh God, now it's impossible to implement under GLP, we'll never have quality assurance, etc. But you know what? Once nobody asked the GLP until we went along and said, do you know what? We've got this skin sensitization assay with genomic readouts. We use machine learning to create the prediction model. The data is actually processed on the cloud. What do you think? And they went, oh, well, you leave it with us. And you know what? We came back with, yes, this was implementable under GLP following these principles. So, again, I think it's testament to, good engagement, focused, you can move mountains. Does anybody want to, I mean, EPAA is another forum if we talk about industry and regulators.
Yeah, absolutely. And I think the EPAA, for those of you who might not have encountered it, the European Partnership for Alternative Approaches to Animal Testing, it's a partnership between the European Commission and the industry sectors of Europe. But absolutely, that's a forum to come together with all those different stakeholders. At the moment, we're coming together to talk through various frameworks for use of NAMs, where the strengths, where the weaknesses, absolutely. Yeah. I'd like to just pick up on something you said there, Marcel. I completely agree with the bubbles bit. Somehow some phrases get a bit of a life of their own, don't they? And I think that you can't use NAMs for classification is another one. It's just we need to work out how. It's not that they can't be used there. The one thing I wanted to pick up on was the validation discussion that's been going on. Obviously, we've talked a lot about this over the years, Maurice. But I think how you move to that sort of evaluation of and trust in NAMs within decision making about protection, not prediction, is going to be the key there. A little plug for a publication of ours that's just coming out in Tox Sciences from Alistair Middleton and the team around, can you use what we already know about combinations of materials and their exposure to look at the validation of new approaches, because we're actually trying to predict things like points of departure and relate those back to human exposure. So those again, it's coming back to the thing of hazard and exposure have got a feature in validation as well as in risk assessment, I think.
Yeah, thank you. I mean, to pick up on that, let's say, I've always said for many, many years, but I'm not sure people are listening to me. I mean, validation itself is part of the science. Validation needs to be as fit for purpose as the methods need to be. Marcel has pointed out that there's a lot of excellent academic, intellectual, and practical, knowledge now out there, encouraging alternative approaches to validation. And I think one thing, I suppose, is always touched upon, and it's a fair comment, Julia, but I always say, hang on a second, if we're talking about validation in the context of developing an OECD test guideline, that's another story, because it's not validation per se. It's developing an international standard that 37 member countries, would accept the data mutually, no questions asked, agencies would. So that is the highest bar, which we'd all love to have in the future, wouldn't we? Everything super standardized, it makes the wheels of the economy go round, But that doesn't mean, therefore, that we shouldn't embrace the use of non-guideline methods and still apply validation principles and processes to establish the credibility of those. So would you like to elaborate a little bit on that, maybe?
Yeah, I think that's a really good point, is that it's the regulatory frameworks themselves need to allow that flexibility for non-standard approaches. Yeah. And it was the point I was making earlier, is that we can't just have a default setting of always reverting back to an animal method, when actually it's not necessarily the best way in which to get the data. Science progresses quickly, and we need to keep up with that. So the regulatory framework needs to have that element built into it that allows us to keep up with the science so we can use the best available data.
Yeah. Do you want to add a little bit on it?
Yeah, absolutely. This is the keyword actually I wanted to that I heard when I heard the talks, which were all excellent, by the way. Thank you very much. Is flexibility, because what I understood from all these talks is that we are all bound by a more or less rigid legislative framework, which we have to abide to when we assess substances, and breaking out of this is also a very good driver, or will probably be a very good driver for acceptance of norms. So I fully agree with what you say. The key word is flexibility, I think. And if I may just go on a point about the reuse, because I think that's another important point, the reuse of data. I mean, we have a lot of data already available, but a lot of it is restricted, not public, or so that would also allow, especially if you go on a very basic level, comparing animal studies with NAMs, there is an awful lot of data available in vivo on certain compounds, and that you could use to compare if you would want to do that. So I think the reuse and sharing of data, and also there are legislative obstacles to this, unfortunately, but also this, I think, needs to be handled in a more flexible way, maybe, generally to allow the uptake of NAMs into the regulatory framework.
Yeah. I mean, it is shifting that, I must say, in our working with our policy colleagues in GROW and Environment, and also at ECHA. I mean, right at the outset, I asked, I remember, Katrin might remember, I asked that first question right at the beginning. I said, if the bottom line is that any NAM proposed for underpinning an extension of the REACH information requirements needs to be a test guideline, we can stop this conversation fairly quickly, and I can save my group a lot of time and effort because of the... Now, again, I say it doesn't mean that the value of guidelines, because there are these international standards, but the answer was basically, well, there are... Can we talk about other ways of assuring the quality, assuring the scientific credibility, the deployability, the trustworthiness? These other words crept in, and that was a very refreshing conversation. So I think there is, for sure, from my perspective, I can witness that there's an openness from the regulatory community. But I often say, you mentioned the gold standard at animal, and often people assume it's because everybody thinks the animal test is super great and brilliant. I often say that it's a gold standard because it is a standard. You know what I mean? Like, you can do a lot with standards in terms of making processes efficient, and you don't have to go through that, in situ validation every single time you get a new test. If it's a pharmaceutical new molecule and you can afford to put that kind of scrutiny into non-standard approaches, but in other processes it isn't. I wanted to jump to a comment here. Look, it's not all about the regulators. Thank you. This is it's about industry too. We don't often talk about industry's enthusiasm/reluctance to use NAMs in decision making. A question here from Nina Reinecke. Excuse me, I'm not wearing my glasses. So, very good one is like, well, would industry be happy if there was a NAM battery that basically flagged your chemical as a carcinogen? Would that be helpful? Or would you run a mile and think, no, I have to do 2-year bioassay, it'll take 5 years, I mean, there's one industry on the panel, but Marcel will have. I'll go to Carl first.
Yeah, I absolutely. Like probably you've gathered from my introduction, I was sort of industry and very pro NAMs, and I think there is this like fear, I think, with NAMs that they are going to start delivering bits of information that you don't know what to do with that will lead to bad outcomes. But again, I think it's working with that data and understanding that data in a way that we have with genetic toxicology data, for example, over the years. You can get a very high dose effect in a L5178Y cell that doesn't clatter the alarm bells of, oh, it's a mutagen, because we understand it and we know what the parameters are of those tests and what important results are from them. And I think that's where we need a bit more rigor around discussing of NAMs, because it's not one test leads to one decision. It is how we integrate them, how we learn about the materials. And absolutely, yes, that may show that a new material we're working on is flagging everything that this is going to be a carcinogen. And then we would not be developing that any further. You know, that's kind of how we use NAMs. Early signals are really useful in prioritization, and then you build on those early signals to give you enough data to do a risk assessment. So I think that fear of, and it was justified fear, I think, that some people may leap onto one result from one NAM and say, oh yes, but that then means you need to do an animal test. But we could be cleverer than that.
But when you hang out with your industry buddies, are you popular in this? Or like there's some people there at the back of the coffee machine going, that guy, you know, here he goes again.
I'm very popular, Maurice. I think you know.
Sorry, I didn't mean for you know what I mean.
No, I fully understand. And there's a spectrum of industry people, and I don't claim to speak for all of industry, because I think if you're a chemical manufacturer with lots of registrations, and maybe not a lot of experience of using NAMs. We've had the luxury of the last 10 years of working with them, recruiting people who know about mathematical modelling, who know about complex cell culture. If you're newer to the field and you're very familiar with how you put together a dossier for current reach, then yeah, I don't say I'm unpopular, but I think yeah, there's a spectrum of opinions, definitely.
Yep, okay, but generally speaking, there is, let's say, interest, motivation in the broader industry community to.
Definitely. I mean, I work in some groups within CEFIC, within ESA, etc., and they're and Cosmetics Europe, and there is always enthusiasm for using NAMs, reducing the reliance on animals, the legal obligation not to use animals unless we absolutely have to. So, but I think there is that education process across the stakeholders in industry, absolutely.
I mean, Julia, from your perspective, from an NGO's perspective, and engaging with so many different other stakeholders, what's your impression?
You definitely see a variety in terms of attitudes towards NAMs, attitudes towards still using animal tests. And it is very unfortunate that we see it in the annual statistics that are produced amongst member states each year, that even for some endpoints, such as eye irritation, skin irritation, animal methods are still being used. And it's in those instances, for example, where we have gone to ECHA and said, look, why is this still happening? What education and training and awareness building needs to be done to make sure that all those sectors that need to be aware are aware of the non-animal methods, because it shouldn't really come down to organisations like ours to put on webinars and training experiences and to be teaching people in the use of these particular methods. But that's why it's so important that we heard earlier about bringing stakeholders together really early on so that people are aware and that they do know how to use the methods, but more importantly, how they use the data then for their risk assessment purposes. So it really is bringing together that kind of collaborative experience.
I'd like to make one point here. I think one nice challenge would be to ask industry, as soon as, let's say, concept is already discussed and developed, now please put in your candidate compounds and give us some test materials to really see if the system is functional. And I think then we will see how big enthusiasm is if we really want to make clear decisions on new compounds, not only the always same model compounds where we have all data and where we first prove the concept, but then really give us the real cases, give us the real materials, and then we can probably put this into risk and other big projects and come to conclusions and work together. That would be a really nice proof of concept.
That's a really good idea, and I'm sure Bob and the other coordinators of ASPIS are very open to being approached, and you have plenty of stakeholder fora and so on for that. And I'd be very happy not to see valproic acid for the millionth time on every list. But very, very good point. But I mean, it's funny, I was talking to Andrea Terran from EFSA just this morning about the DNT, the developmental neurotoxicity battery. And in fact, you know, that project that the OECD is shifting into now, deploying the assay. So prior to start talking about, you know, validation in the context of development towards a guideline, which eventually it would be nice to have, is can we get these methods out into the play and get companies having the opportunity to go and buy data, because let's face it, it's only very few large companies that have the capacity to generate data in-house and rely on CROs and the availability of these testing services. So I think there we're talking a lot about, look, how can we practically deploy these to follow what you're talking about, get the users to gain experience, and there's a lot of smart people in these companies, looking at this data. I mean, Marcel, you've been heavily involved in that activity. Would you like to comment a little bit that on the pragmatism you've took on readiness criteria and stepwise building a confidence and this potential next step?
I hope I can help. I would like to go back to the initial question whether a company would like to have their compounds classified as a carcinogen. Scientifically speaking, this comes back to specificity. So that's what people are afraid, and that was also mentioned by Tomasz. Would we be able to define the negatives? So this is what specificity is about. And of course, if there are many NAM, people could be afraid. There are many endpoints that could be positive. But that's, of course, a question of tuning the prediction model. And I think in this respect, I would only like to make one point. We should look at the alternative. So the alternative are the animals now. So of course there have been many problems. There has been phospholipidosis triggered by 25% of all chemicals until people learned this is not important. Then there has been peroxisome proliferating cancer in mice until people learned this is not important. So one had to learn to tune the animal model in specificity. And we still have these problems. The big discussions we are having on glyphosate now, this is not a NAM problem. It's the interpretation of the animal studies, whether it's a carcinogen or not. The German Institute of Risk Assessment changed the daily intake values of bisphenol A some weeks ago by a factor 10,000 downwards. So this is an animal thing. It was not a NAM coming up. So NAM can be specific, animals can be unspecific, and the other way around, but it's not an inherent technology problem. It's getting confidence and experience with the technology. And we should never look only at one, but always at the comparison between the two approaches we have. That makes it clean.
Yeah, I think that's coming loud and clear from this whole session about the bigger framing. The proper problem formulation might shed a lot of new light on all of this, which isn't scientific, let's say, per se, from the NAM perspective, which I think often happens as we get zoomed back down into we need better stem cells, or we need better, computer predictions, but maybe it's a bigger frame. I wanted to jump to, there was a question there about should the European Commission coordinate a discussion between different agencies to make sure they assess NAMs in the same way. I'm the only Commission representative on stage, and if I see Katrin nodding, then I know I'm on the right track. Well, first of all, there's already, I think, a very good engagement between agencies. And Michael, maybe you could say a couple of words about that.
Yes, thank you. Indeed, there is actually a very good engagement. It could be better when it comes to NAMs and maybe discussions about certain other things. But yes, indeed, there is good engagement between agencies, which now actually, because the Commission was mentioned, and as far as I saw, one substance, one assessment is actually being brought forward to be even better and brought under the same umbrella. There are obviously a few complications with this or legal barriers associated with this, but I think in general cooperation is very good and also needed to get to a common goal. When it comes to NAMs, as I said earlier, I think there could maybe be more discussions in terms of acceptability, but generally, yes, the cooperation is good.
Yeah. I mean, to be fair, there's always room for improvement, and I think this oneness of this conference and the fact that you're here, reflects the interest. Also, I mean, within the context of the chemical strategy for sustainability, Katrin mentioned earlier, the one substance, one assessment ambition, which has tied in a lot of other objectives like more efficient data sharing between agencies, very importantly, better use of what's called academic data, so the non-guideline data that we all feel is out there and should be used. Keeping in mind there's a regulatory requirement on registrants to use existing information if it's available, and also on agencies to look at that, but it doesn't really happen that efficiently because I think, as mentioned this morning, often it's it's difficult to bring that out. So I think from that perspective, that's a current initiative from the Commission that is bringing very much agencies together and bashing a few heads now and then. But definitely, it's a very valid point, and we need that cross-sector collaboration, don't we? I mean, I wanted to touch maybe on a tricky point: is trust. Katrin mentioned a report that JRC, my own group, produced recently on evidence needs for chemical risk assessment. And one striking fact that came out of that was the sheer lack of trust, particularly between the regulatory community, industry community, and also civil society. And it was startling in all of the very thorough interviews and research of that coming up out all the time. And we weren't expecting that. The study had a different angle, but in the end, I mean, is this the panel to have that discussion? But without trust and transparency, it's not about NAMs really anymore, is it?
Absolutely. I think that trust in NAMs is a big part of the whole journey, to be honest, because you mentioned the EPAA activity, and I think it's more things like that, and like the forum that you've suggested. It's coming together and discussing the science and admitting what the weaknesses are, seeing where the strengths are, and building on that. Because absolutely, you would say that, wouldn't you? You invented that test or whatever. That's kind of a human reaction, I think, and having those like non-partisan discussions on what are the facts about this NAMs in this situation. Oh, they're good for making those decisions for that purpose. Oh, we need them to be slightly different for the things we want to, and having those discussions rather than sort of being poles apart, saying, oh, we can't use that for our, I think it's building that trust, absolutely.
Coming back to Michael, I suppose building those fora, we mentioned the EPAA. I mean, that's been very successful in bringing particularly industry and regulatory community together, policy-making community, and having very open discussions. And I know, it's funny, Bob, I don't think you haven't, we undertook this kind of ad hoc review of EU tax risk when we were trying to identify innovations. And just to work with the consortium to say, look, from our perspective, from things that might have a regulatory application and interest that you might not be able to see, from a perspective. And so we went through it, and one of I left the team go off and do it, and one of the things that came back, they said, you know what, we've interviewed all these people in the EU tax risk, and I was expecting them to go, and we found this amazing in vitro method and this amazing stem cell modeler. They said, you know what people think were the best innovations in there was the Regulatory Advisory Board and the Scientific Advisory Boards, because they felt that this became a real melting pot of ideas and I remember the early days, it took a couple of years before certain regulatory participants, but also industry participants, began to really open up about what they really thought, because it's very easy to get, oh yes, it's fantastic, it's brilliant, it's amazing. And it wasn't that curious that in fact, I guess Marcel, well, both of you have been, and Sylvia, involved heavily. Would you say that that's part of this pathway forward you were talking about, is creating those environments?
I think so, and it was also mentioned many times that it was documented in the case studies.
Yeah.
So which underwent additional levels of review and feedback, and then feedback meetings, and again conversion of the knowledge into the final form of the case study.
Yeah.
And just this project brought 6 of these OECD case studies up, so that's a big percentage of all of these IATA case studies. And altogether learned a lot from the regulatory side and from the academic side.
But it took time to build that trust in that. Sylvia, do you want to add to that?
Yeah, I think I'd like to add to the case studies and the learnings. I think we even in the beginning had a very difficult time to agree on terminology. What is, so to say, a problem formulation, and then also how to address a problem formulation. I think the first 2 years we were asked continuously, okay, now you have the case study, what is your problem formulation? What is the regulatory relevance? And then again, although we worked on that and we tried to make it more explicit, again, the question was, okay, nice, but what is the regulatory problem formulation? And again and again and again. So this is, so to say, how we, so to say, came closer together to understand each other's needs, and also, the regulators did a very good job also by counting into the new methods and also try to understand what they bring, where they are, what are the limitations, what are the different uncertainties. So it's a kind of learning process on both sides. And I also think that the regulatory engagement in the case studies and how we learned it together was one of the big achievements. And therefore, we also proposed here in the EFSA roadmap that this is an excellent tool, but this is, so to say, first step. And then we need to generalize it, as the others said. So not, so to say, put it on paper, done, but now we need to really come to conclusions and then also apply it to other problem formulations and do it more interactively.
Yeah, wonderful. Well, maybe that's a take-home for ASPIS, that the 60 million euro of taxpayers' money as well. Let's not forget. So we want to hopefully use ASPIS, Urian. There are many other big initiatives as a kind of a safe space to get people together and really work out some problems.
And I think the regulatory industry, academia discussion on where we're heading with this is just, it needs to keep going as well. And I think having the detailed discussions on what are the niggles with these tests and things, because I think Rusty was mentioning earlier on about how it's going to keep evolving this. There will keep being new NAMs, there'll be keep being new approaches. That's how science works, and we must have that dialogue between everyone as to what we can now use and pick up and slot in there that's the new science. We can't have what happened with animal tests, that somebody invented an animal test in the 50s and we're still lumbered with that same test. The whole of the how we use NAMs and having those, I'd say those detailed scientific discussions, scientist to scientist with regulators about specific chemicals, specific tests. I mean, the amount of time some of our guys chatting to Rusty's guys about, is that the right mathematical model for that or whatever? That's what needs to happen. We all need to be at the same level of discussion, I think.
Yeah, shared understanding. I mean, and if we do manage to break through what many of these things are glass ceilings, I mean, there is hope and there's ambition, and Marcel, you put it in very well early on, that the world is very much brighter, much better than we have today, and we should be looking at that. And like you say, if we manage to get the machinery going, hopefully our ability to take up these new methods will become more efficient. Keeping in mind too that all European legislation has direct provision for a legal requirement to be updated when the science and technology dictates it should. So again, there's legal provision there, but sometimes it's easier said than done. We're coming to the end. I want to take a very practical question from my old friend Francois Bousquet. I'm sorry, you know what? I feel really terrible. My back has been to you all. Forgive me. He's asking, are NAMs commercially available and affordable? Do we need to get our checkbooks out if we want to do anything? Anybody could speak to that. I mean, I guess, again, you probably in the business of procuring.
Yeah, I think it depends which NAMs you're talking about. I think if you're talking about the NAMs needed for creating all the data around a PBK model, etc., yes, they're commercially available. Many of the NAMs we use CROs for, maybe not the traditional CROs. I think that's the thing. I think there's a whole new breed of smaller CROs with specialized services that are maybe not the traditional big CROs. Are they affordable? We're finding they're affordable, but whether that's affordable for everybody, but when you think of the price of the animal tests, I don't think the NAMs are benchmarking too badly against those.
Okay, well, Julia, do you have something? Yeah, please.
Yeah, I just wanted to, bring that point to the price of an animal test. It lets us remember it is the price of a life as well. So just bringing in back that ethical aspect, but also the legal aspect that there is a requirement not to use animals if you can avoid it. And so sometimes it shouldn't come down to money. And actually, legally under the directive, it can't come down to the cost of a test. Yeah. It really is about, well, if there's an NAM available, you have to use it, regardless of price.
Well, you know what? What a great way to end this session. Yeah. We're going to stop it there. So, on all our behalf, we'd like to let's thank our panelists. Wonderful discussion. I really appreciate it. That was a wonderful chat. So we're going to just move to wrap up now. George is going to join me. But thank you all again.
Thank you very much, and good morning, everyone. Or it's good afternoon already. So first again, I'll thank you for the speakers and the panelists for excellent discussions, excellent presentations. Thank you to you, the audience, for your questions and being so many of you. We had a very interesting journey through through NAMs, the world of NAMs. We had a bit of a historical overview. We're talking about 20 years of investment into NAMs. We've been talking about 1 billion euros have been invested into NAMs. We've also been bringing up some setbacks in the sense that we're still dealing with a large majority of the photo, yes. Large majority of substances that have not been tested, and would be very difficult to test all the chemicals that are available that we deal with. A lot of the challenges have come from the fact that the approach we use in terms of trying to bring the NAMs into a regulatory context. We're doing a one-to-one validation. We're questioning the robustness. We're questioning the validation. We're dealing with uncertainty, how we're going to address the uncertainty. But we also mentioned in this morning's session, so the first part, there's a lot of opportunities, and I want to really dwell on the opportunities. So case studies, huge number of case studies being developed that are really helpful for the regulators. We've been talking about ECHA, ASPIS in the EU. We're talking about OECD as a major port in terms of helping taking the case studies further and for validation. What is another message that came through is the importance of having mechanistic information really helps to better understand and to help with the regulatory assessment. But we also need to get the expectations right. That has also been a very important message, getting also going to a paradigm shift and using different ways of approaching the challenges produced by NAMs. And of course, collaboration was already mentioned this morning. We presented, or Sylvia presented the EFSA roadmap, which touched on a number of these points. Important to have an evolution to better understand and have more mechanistic information. We also seen that some areas are very tool-rich, but other areas are tool-poor. So we really have some areas that really have to invest in terms of building up AOPs, building up IATAs, building up NAMs to support the work. Also, investment in the area of toxicokinetics are very much needed. Also to help at the end to integrate all the data that come to us. I think from the panel discussion, again, an aspect that emerged is that really the issue of threshold of acceptability. We're putting NAMs on a much higher pedestal in terms of acceptability, whereas really, if we think about it, the animal studies, in vivo studies, have been spared to much of this scrutiny that the NAMs area is, or the NAM tool are being subjected to. So where do we go from here? I think important is cooperation. Cooperation is absolutely essential. It can be in the form of fora, stakeholder engagements. We've been talking about bubbles to ensure that we work together rather than work in bubbles, so we understand each other. We need to understand what are the regulators' needs. How can we help to, also as regulators, to qualify and integrate the methods? And also an important message is we need to be flexible. Use of concept of flexibility to help us bringing the NAMs on board. Another area that was touched upon is that of data sharing, accessibility of data, very important. And also finally, an area that perhaps we haven't touched upon, was not the main subject of this conference, but we should not forget about it. It's environment. We're talking a lot about human risk assessment, but NAMs are equally applicable to ERA. Some complexities that come with the many species we're dealing with, but it's something we should not forget. What would be my take-home messages from EFSA's perspective? Again, cooperation and engagement to help the implementation and integration of NAMs in the regulatory risk assessment. This, of course, we need to build up on the confidence and the experience. And from EFSA's perspective, NAM is a priority area. It's mentioned very clearly in the EFSA strategy. It's the reason why we're all here, why we have this session. And perhaps last but not least, EFSA is also investing a lot into NAMs. So we're having a number of projects that some have already been launched, some will be launched shortly. And I think it's fair to say that by the end of the year, the envelope that EFSA is putting into NAMs for regulatory purpose is around the 20 million euro mark. So we're very keen to invest into the development and to support and, of course, do all this in cooperation. Thank you very much.